Hi, good evening, everyone. What we're going to do is we'll start right around 6:05 because I think some people will be trickling in. So hang tight as we admit some people in, and we'll get started at 6:05. Looking forward to it. I hope we don't go over 100, Frosto. Then we got to start kicking people out. All right, one by one.
Everyone's going to rotate.
I was kind of kidding, but if we approach like 80, I might actually get a little bit nervous here. Let's see.
Didn't you put the password code out on the internet? Like
all over for anyone.
Mm-hmm.
It's funny. I told Reddy, I was like, don't worry about your presentation. There'll be like 9 people on. Did it work?
Eric, I'm going to call you quickly.
Yep, sounds good. All right, just like how we start every Zoom meeting, can everybody hear me okay? Looking for the thumbs up. All right. So welcome everyone to the 2021 All New York City EM Medical Student Symposium Extravaganza. I had to add extravaganza to that because it's been quite a year or two, and we've been doing everything virtually, and this will hopefully not be a letdown for anyone. We have such a great lineup tonight, and I'll introduce myself first. I'm Eric Steinberg. I am one of the newer members of the All New York City group, but I've been doing residency stuff for quite a while. I'm the program director at St. Joseph's University Medical Center in Paterson, New Jersey. And before that, I was an associate program director in the Mount Sinai system in New York. And so we are joined by some really great friends today, anywhere from vice chairs to program directors to residents, clerkship directors, site directors, to assistant to the regional managers, every title possible. They are here and they bring a whole diverse wealth of experience and a really wonderful approach to what we're going to try to emphasize today, which is the journey and the timeline of residency application for emergency medicine. And we know, especially over the past couple of years, things have changed a bit with virtual interviews and with different recommendations about rotations. And so there's a lot to talk about. But what we're going to do first is we're going to kind of go through the different aspects of the application process, and then we're going to have a question and answer session at the end. At first, some housekeeping things. At first, we thought we were going to break into breakout groups at the end, but we want everyone's questions to be heard, and we're actually going to be recording this for the people that can't be here. And so we're just going to do a moderated Q&A session for everybody. And that way you can ask any of the panelists anything. The easiest way for that to work is as questions come up. So it could be during somebody's talk, or it can be during the break, or whenever you feel like it, please just use the chat function to ask your question. And we'll be monitoring that, and we'll be addressing those questions at the end. All right, so without further ado, I'm going to introduce our first speaker, who's going to give us pro tips to crush the clerkship. That's what everyone wants to know. How do I do well in the clerkship? And this is Dr. Pik Mukherjee, who's an associate professor of EM at Hofstra North Shore LIJ, Zucker School of Medicine. He's a program director, site director at Northwell LIJ, and he's also the director of the Med Ed Fellowship there, I believe. Without further ado, let's hand it off to Dr. Mukherjee.
All right, there you go. Hi, guys. Thanks for coming. Sorry I'm inflicting this on you via Zoom, but hopefully not too much more. One nice thing about being the first speaker is no one has gone over time yet, but I will try to be respectful. So I'm Pik Mukherjee. Yeah, I'm at the Zucker Northwell program, so 3-year program, multi-site, all that stuff. You guys want to know about the clerkship. And one thing is we call it a lot of stuff, right? We call it the audition rotation, the clerkship, the sub-I. The big thing is there's a lot of stuff out online that is very easy for you guys to find, right? If you took less than a second to Google it, you would come up with some really good resources. So I'm not trying to replace those resources. I'm directing you to them, but I'm not going to explain to you what the most common chief complaints that you should be prepared for are, or how most attendings want you to present, or how you should set expectations at the beginning of your rotation, because a lot of this stuff is there. So what can I do for you that's going to really change what you do in about the next 15 minutes when you are coming on to our rotation? So I think you have to start with the end in mind. 4 out of the 5 things that are the most important things that faculty in teaching programs look at are related to the rotation. Away rotation in the specialty, a rotation in your hospital department, clerkship grades in that specialty, right? And the letter of recommendation. A letter of recommendation is consistently the most common #1 answer when people in academic programs ask, what do you look at? So what you want out of the clerkship, this audition, rotation, job interview, basically, extended job interview, is a grade slow. That is your goal, right? Begin with this end in mind. Again, Google is your friend. Type in slow, emergency medicine. Go download the slow. You have the rubric of how you are being graded and what people are looking for, right? Very easy to find. I can't navigate the NRMP and the ABEM and the CorDM website properly. I Google slow emergency medicine. It takes me there. These are the things I want to read, though, right? I want all 5s. I want top whatever percent, but I want to read ownership of patients. I want to read needs little guidance. Problem-free resident, right? That's part of that well thought out, career advice is not needed here. And then I want to see something like, the best would be functions at the level of an intern, right? That would be absolutely the best. So no problem resident, cares about patients, takes ownership of patients, and functions as level of an intern. What do the negative slows tend to have in common? What is the single most common comment on sort of the bottom third that people are going to see? It's this: differential diagnosis below their peers. if you are going to do, and I understand, sometimes this is a proxy for generally not translating academic test stuff to clinical bedside stuff, not able to communicate properly with their presentation. Again, there are specific structured things you can learn by going and practicing how to present. But if you just make sure to give me a differential, it's hard for me to check this box. So if by not doing this, you're already above the bottom third, right? Now you're just average and you got to get to be awesome. So 3 things. Step 1, be memorable. So what does that mean? It means there's a lot of you. You guys are like the 1-year cicadas, and every July through November you swarm. And then I sit in a room with like 7 people, and we have a massive PowerPoint, and we are looking at and we're like, oh, Chris, is this the Chris I love, or is this the Chris that pissed off that guy? And then we have to do some homework, right? You are gonna not want that to happen to you. Don't be mistaken for Jenny, the other Jenny. So how are you gonna do that? You're gonna remember to say your name. You're gonna introduce yourself over and over and over until it seems slightly painful, and you may have to read the room a bit. You should not do it at the end of a mega code when we lost a young patient. That's not the time to say, associate me with this moment, but you're gonna say your name out loud. Hello, I am Eugene Cho. I'll be working with you today. I'm your medical student. Then you're gonna talk to the nurse right behind that person, and you're gonna say your name again, even though she was sitting 2 feet away, right? Now that you've come around the desk, you say, hi, I'm Stephanie Pollock. I'm the student working on this side today. Hi. You're going to do that to the resident, to the intern. Right when you think you're getting too annoying, you're going to say it one more time, and then you might stop. And now you will be memorable because your name is coming out of people's lips. And when you do something right, they're going to say, that was Stephanie Pollock. So how are we going to associate your name, your memorable name now, with good behavior? So that's step 2, be for the patient. We say this over and over and over, but I'm going to try to give you some very concrete things to do. This is the patient in the middle of the screen, so they're in the center. When I made the PowerPoint, I thought it was funny. First number, be focused. We want you to not be shell-shocked by being there. We want to talk to you and know your personality. You're going to be asked to pass the 3 a.m. test. Can I talk to this person like a human being? Can they talk to patients like they're a human being? But that doesn't mean I need your list of extracurriculars. It doesn't mean I want you to enroll everyone in your bracket for March Madness. It doesn't mean I want you to share your love of polka dancing and all the awards you've won on shift. Pre, I'm waiting for sign out. Post, we're going home. I know you guys want to talk to the residents. Do that, right? But if you are showing me your TikTok video, if you're looking up your bill pay app, even if you're studying for your shelf exam, you're studying for a clerkship exam, man, if you are in here when stuff is going on out there, you are gonna miss getting pulled over that code, and you're gonna have me think you are not looking at the patient, right? So being focused on the patient on shift, right? I know you want to read on your patients. You don't do that on shift. It is a very busy department, right? Even in the lulls, there's usually very brief times of saying, yeah, I also hang glide and went to Brazil on that clip. It was great. Now, can I see that patient in room 9? If that's what you want. And when you get to that patient in room 9, right, they've been waiting because we have busy departments. And maybe you have a little bit of I need this person to think I'm memorable and associate me with good behavior. And so you are going to begin with a little bit of, I'm going to help you because I'm patient-centered. Hello, I'm Eugene Cho, the student working with Dr. Mukherjee. Let me help you get things moving. Right? You are almost at the front of the line. You can see the ride. This is the final Disney room. And I like to start off with something like, I know a little about you. I 100% am going to inflict upon you some history taking that I know you may have talked to the triage nurse and the charge nurse, but the nurse says you're having chest pain. And then they have the opportunity to go, no, that's wrong. It's stomach pain. I say, oh, let me help you get the right, tell me. I want to correct this for you. And maybe it's, yeah. And then you're like, tell me more, right? Because now I'm going to spend time with you. I want to do this for you. Not too much time, because it's very busy and you've been waiting a long time, and my job is to expedite your care. So 10 minutes on average from the time someone hands you that chart, assigns you that patient, right? If you stand and look at the chart and do a chart biopsy for 5 of those minutes, I'm going to think in my head that you are a budding internal medicine resident, okay? It is a good skill to do a little chart biopsy, to go in knowing the vitals, the chief complaint, what happened up at triage, right? Those will save you. But it can't be for very long, because on average, 10 minutes. 15 is for the history is difficult, I had to get a translator phone, something else. But past 15, no. You really need to be, because the time you are in there is honestly, from the point of view of the patient, even if you're going to make them feel really good, not effective care yet, because there's no orders written. You have to tell me what's going on. We're going to double check your work a little bit. The resident's not writing. So this time, how are you going to make this time work for the patient? Not too long, and you got to get the right information, right? Again, I'm not going to go over the headache. I should probably ask about, was it sudden, severe, maximal within an hour? Every doc wants to hear that, but I'm not trying to teach you that now, right? That's where your resources are. And when you're ready, you can say, I'm going to relay this to the supervising doctor. Let me get this in front of Dr. Mukherjee as quickly as possible, right? And then, as you're in the doorway, but you have not left, right? You're going to ask them if they have any questions. And this is what you're going to say. What questions do you have? Not, do you have any questions? Do you have any questions is I am out the door, and if you stop me, you're delaying your care. That's not it. What questions do you have? You will get 60% more answers, more responses to this question. And that sets you up for being the hero that is patient-centered. I'm going to get you the answer if I don't know that. I'm going to find out if you can eat. My God, if you come back with water and like say, do you have any allergies? Let me try to get you a tray. You're the hero, right? And then you're going to say, okay, again, introducing, memorable, I'm Stephanie Pollack. I'm the student working with the supervising doctor. I'm going to go get them right now. Ask for me if you need anything at all. I'm here to take care of you. I'm the medical student assigned to you. Now you're not a barrier to get the resident and the doc in the room to write those orders. Now I am your personal concierge through this journey, right? And now they are going to say your name. They're going to say, Stephanie was the best. And the nurse is not going to have the patient standing out in the door yelling nurse to the world, right? Because they don't remember which nurse, and the nurses take shifts. But they remember Stephanie. And then Nurse Ratched is going to be your friend, because Stephanie is going to go and figure out what's going on and take care of the easy things, the pillow, I will find out if you get water, and move on. And here's where we get to ownership. Ownership is really responsibility. And you can't show that you have taken good responsibility if no one has given it to you. So you must actually put yourself in the place of, I am the person who's the interface between the patient and the world, right? There are other people, important people, Dr. Mukherjee and a chief resident and a junior resident and an intern and 3 nurses and 2 techs and a registrar. But I am your interface to the world. So when you are not registered, and that's why your prescription won't come through, I am going to bring that person with their workplace on wheels into your room, right? When they need a urine sample and it's holding up your CT, I am going to get you to pee and bring it there. And that is ownership. And I'm going to show responsibility by taking responsibility, right? And you're going to be the informer. And you're going to say that word, not like snow, but you're going to say, I want to update you. Let me keep you informed. What questions do you have? Again, I'm Dr. Eugene Cho, your student. I want to keep you informed, right? And then actually do those things, right? If you say, I'm going to figure out about the water, do it. If you say, I'm going to be back with a pillow, man, you better do it. And once you do, once you close that loop, you will have trust that no one else has, and you will own the patient. And then when the attendant comes in and says, ma'am, we need to go to the operating room. You have appendicitis, and the surgeon actually wants you. I'm not even fighting him. When they look over at you and wait for Stephanie to give the nod, then you've won, right? And then a key thing for this that's going to get you out in sooner than 10 minutes is asking for help. I know you want to get the best presentation, right? I know you want to get all of the findings and do a great physical exam. Don't let that get in the way of being patient-centered, right? Because you're going to come out too soon and say something like, excuse me, Dr. Mukherjee, the patient, Mrs. Johnson in room 9 with abdominal pain, I actually didn't finish with her, but she's worrying me because I know that a blood pressure that is 2 digits and not 3 might be cause for concern. Again, that is a Google search before you get there, right? But I'm concerned because her mental status is off, and that wasn't what she was here for. I'm concerned because all I did was touched the belly and it is a board like I read about, and I'm going to finish my history exam, but I wanted to let you know. You could say, I hope I'm not overreacting. You don't have to say, I think it might be neck fascia. That's okay. But do you want a resident on this case with me while I go back in? Do you want to come and do the exam just to reassure me? And I will get the rest of the story, right? That is huge because it shows that you are for the patient. You could have stayed in longer to try to impress me with your full, thorough presentation, but instead you said, no, this patient has potential to do something bad, right? And so now we got be memorable. Your name is on everyone's lips, including the patient. When they leave, they're going to say, thank you, Dr. Stephanie Pollock, and say, I'm not the doctor, but they won't remember the attending, right? That's the man behind the curtain. You are the interface. So you're going to be memorable. You're going to be patient-centered, which leads to better care, and then you're going to be useful. And by useful, I mean you're not just paying attention to the patient's pain, pillow, potential for getting worse. You're going to be useful to the entire team, right? And how are you going to do that? Well, it's by thinking ahead, right? You are now a medical professional, right? You're an unlicensed medical professional. You don't have the MD on the end yet. You know what my residents are? They're like semi-licensed medical professionals because they don't have fully boarded insurance will cover me yet, right? But you can guys all take care of patients. So how are you gonna do this? There's a bunch of things. One big one is, you know, that dead time before the doc gets to write orders? That can be really useful if you need a translator, right? Because that's a lengthy period. And now if you say, I had to use a translator phone for Haitian Creole, for Urdu, for, you know, and it's set up. And let me know if you want me to set that up for you, Dr. Mukherjee, because I have the phone right here. Or, you know, we got these iPads in the last year, which are so much better. If you find the iPad and punch up, you know, Bengali and have it ready to go. So it's just attending comes in, hits the button and says, did this really start at 7:02 starting Jeopardy? That it really is sudden onset. Hey, Stephanie Pollock, medical student, I'm with you on the Let's Work Up SAH, right? And now you're off to the races. Really appreciate it. Even if it's something you can't do, but you can prepare for, you're thinking ahead. I noticed XYZ, maybe we should do this, let me prepare for that, right? So that's part of being an interpreter. The interpreter, again, as the face of that you're watching, not maybe the decision maker, is a really important thing to the patient. I'm going to give you a little vocab that all of the education people use, the RHYME. If you guys haven't heard of the RHYME, it's okay, but it stands for reporter. And then interpreter, this is the level at least you must get to get that nice ding on your slow, or manager, right? Reporter is, I got the pertinent information and relate it reliably, right? I asked about sudden onset for the headache. I asked about radiation for the chest pain. I asked about allergies for everybody. Things change, we get that, right? But it's okay to say, oh, I was so concentrating on the surgical abdomen, I didn't actually ask for allergies. Much, much, much better than not, right? But the interpreter is yes and. Remember that? Like I'm the person responsible, I have ownership, so I'm giving updates. You're also updating the team. You're updating your attending that the patient has more pain. You're updating the attending that the hemoglobin is back. And the interpreter comes as, Dr. Mukherjee, the hemoglobin is 7.1, and 3 weeks ago it was 12.2. And this is the interpreter, so I think that she probably needs a rectal exam and we should consider GI bleed in a way that I didn't previously on my differential. So I will get the guaiac card and the lube, and I don't know if I need a chaperone or if you wanted to have the resident do it and I'll be the chaperone, but look, I'm useful and interpreting, right? And then managing, again, for the patient, right? Reminding the patient, not just reporting that there's more pain or saying that maybe the homeopathic 2 milligrams of morphine wasn't enough, but actually saying, let's do, you know, I think we should probably give her more pain medication. And then being told, no, we're going to do this first, or being told, that's okay, right? And the E is the expert. I don't know why it's there, because you just got here and you can't be the expert. And I don't mean to say that you don't know what's going on. You could actually have this disease and know more about it than anybody, but you just got here. And if I walk into a new place and a new job or something, and I think I have a enormously good handle on how to take care of this patient, I'm not the expert because I don't understand that in this shop, a sono after midnight takes an extra 5 hours. And that's why we're not going to do that, right? And if I can't be the expert because I just got there, then I'm sorry, you can't. And you shouldn't try. And you should show some humility in saying, I'm suggesting, but of course, you're the licensed professional, right? Right? So I can't do it, and I'm me. I mean, no offense, but like, right? This is going to also show that you have some idea of that. I'm out of my depth here. That blood pressure is bad. Someone should know, right? And it is okay to not know things to get you really to where you're comfortable in the interpreter manager land. That is fine. because I don't need you to be 100% knowledgeable. That's not expected of you. And you're going to have knowledge gaps just like the residents do. But I need you to be reliable, because you can't get to trustworthy interpreter manager if I can't trust the reporting. And that goes back to, if you didn't do it, say you didn't do it and go do it, right? Because you're in and out of that room all the time. Again, you are the face of the place. So be memorable, be patient-centered, be useful, right? In a way that the attending's brain is going to places and you are there. Headache, was it sudden? I got that for you. Chest pain, was there radiation? I got that for you, right? Have what they needed. Guaiac, right here. Here you go, I got that for you, right? If you got those things, memorable, patient-centered, useful. I was muted for a moment. I don't know why. I'm sorry. It might be that I'm over time, because I only got 1 minute left.
My fault.
Okay, it wasn't a cutoff. I get that in conference sometimes. Shut that guy up. If you have these 3 things down, you are just so close to that awesome slow. And here's the get to the end point, right? Because you've done your homework, right? You've studied presentations, but now you got to actually practice the bit that includes that stuff. And this is how you're going to do it. You're going to do it with, again, the differential. Remember the thing that you're never going to be able to say about you, that you didn't have a wide differential? You got that. So here is your presentation land, incorporating those other things. Hey, Dr. Mukherjee. Stephanie, I saw the lady in 9. Your Rick told me to go see them, Rose in charge. Yeah, I can present them if you like. I have an X-year-old, male or female, presenting with, let's say, chest pain. And they likely will be able to go home with a minimal workup, or they likely will need to stay. Or maybe I'm not sure if they will be admitted because they have some concerning features. That's your bullet. That's your one-liner. That sets my brain up for where you're going with this. Take me home, right? Now you're going to do your presentation. You know, you can ask ahead of time how you're going to do it. Vitals first. People can be particular about this. Some of the attendings really want brief. We're ER docs. We all have ADD. We want to be brief. But at the end of your blurb of stuff, which is not going to go that long, you're going to say, this patient, I think, likely has, or is most concerning for, or top of my differential, whatever it is. And I know we tell you guys include lethal things. I know we tell you guys top of mind things. But it is okay to mention it without being top. This patient likely has musculoskeletal chest pain because it started right after they lifted the suitcases and it's quite reproducible. But I also would consider ACS, pneumothorax because of pleuritic nature, and even early shingles lower in the differential, but there. And then this is the place that even the residents tend to need prodding to get to. So if you get there, man, you're almost at that function like an intern level. Our plan will be to do an EKG and a chest X-ray, and that is all, and then they will go home. Or conversely, our plan will be to do labs and potentially repeat troponin with an idea towards either the OBS unit or admission, and repeat EKG, a serial EKG because they still have chest pain. Man, now you're getting to interpreter manager, right? And I can't say you don't have a wide differential. So now your name's on everybody's lips. The nurse is like, who was that? The patient's like, Stephanie, you were so great. The admitting hospitalist is like, who got the translator phone in there? That was Stephanie. And then the attending's like, I remember Stephanie had a wide, broad differential, unlike Chris, the guy who I couldn't figure out who he was. And now you're where you wanted to be. You're at that, like, that slow. That's the goal. Top third, top 10%, and you are done, right? So you say your name way more often. You tell the patient, I'm going to help you this way, and then you actually do it, and then you are useful in a medical way. It's good to be useful in a nursing way, right? Everyone's going to love that you, like, got the bloods in the thing and put the labels on and expedited the urine. But, man, I want you to show that you can do the doctor work. And that's why you got to give me the interpreter manager stuff, okay? So I'm going to stop there. I'm going to stop sharing because I overshare sometimes. And at this point, I will 100% let Eric mute me if needed, or if there's chat things to get to.
Well, thank you. I know you can't hear the roar of applause, but it's happening right now. And we really appreciate that talk. And just to kind of summarize some of the key points. So, you're going to hear this a lot tonight. It's all about the slow, right? And I think we have students here at different levels. So the slow is the standard letter of evaluation, right? So you could definitely Google it. And that's what really is going to be the crux of how we look at applicants, which we'll get into a little bit more. Things to be memorable, right? Say your name over and over again, useful, reliable, but humble, right? Don't have to be the expert. And then, of course, just like in residency and still in attending good, the crux of emergency medicine is the differential diagnosis. So if you go with that approach, it's all about the differential, then you'll be good. All right. Remember, please, if you have any questions, use the chat function, and then we will address them at the end. Dr. Mukherjee, thank you so much. Really appreciate it. And sorry for muting you. That was one of those subconscious slips right at the end of the presentation there. So let's take 2 minutes, and we're going to get Dr. Fernandez up next. And when she gets her slides up, we'll get started. Oh, that was really fast. We're working with pros here. So up next, we have Dr. Elizabeth Fernandez. She is the Assistant Program Director at St. John's Riverside Hospital, which is a fairly new program, an up-and-coming program that's doing a lot of really cool things in Yonkers, New York. And Yonkers is not upstate, okay? I was told that anything north of the Yankee Stadium bleachers is upstate, and that is not true. And so she's going to be talking about the ERAS application and the personal statement. What do we actually care about? So the floor is yours, Dr. Fernandez. Thanks for joining us tonight.
And of course, I just lost my slide, so I'm going to fix it, hopefully.
All good.
Oh, no.
Personal
This is what I get for trying to fix it.
It always works perfectly during the practice session, right?
No, it's good now. All right. I was just missing a window. So thanks for the intro. Sorry I couldn't be here a little bit earlier. One of the joys of Zoom season here. I have some childcare issues, so I'm going to be in and out. But I am APD at St. John's Riverside up in Yonkers. We are not upstate. That is true. It's just Westchester. I promise you it's not that far. I helped start the program back in 2017. So we're in our 4th year now. We just got our 5th class starting in a couple of weeks. And as a newer program, I've had to read tons of applications because also as a newer program, we tend to interview a lot of people, right? We're not as well known. So it's something that I certainly pay a lot of attention to. I review hundreds of applications a year. So just in the way of disclosures, a lot of these opinions are based on my own experience, but also based on the experience of other people that I've been working with over lots of years of education. But first of all, we're going to talk about the ERAS application, what to do and what not to do. So first of all, don't put the fluff. We can tell. If there's something that your school made you do for an hour at some point, probably wouldn't list it as a big item on your CV. But if there are things that you did that are some sort of service, some sort of reward that you got, go for it. Next is don't leave things out. Go over it with an advisor because there are a lot of things that you might not think are important, but they're actually a part of your life and they are important to us. And I'm thinking about, people that had a different career, did something else at some point in their life. If you don't include any of that stuff, we kind of wonder, where were you between college and medical school? We want to know, what you were doing with your life. And for that matter, don't be afraid to put experience that may seem humble to you. That could be part-time jobs. Maybe, like one of our residents was a dog walker at one point. She was making some money during medical school and she wanted to get some exercise. We have someone who's coming in this year who was a Door Dasher during during the beginning part of the pandemic because he wanted to help people out. He was delivering food. They show that you know the value of work, but it also explains why you might not have time for other things. So we've had plenty of students who have come through who had some sort of financial constraints. And that does figure into how we review the application. If you had constraints and you had to work while you were a student, then we get it. You may not have 50,000 activities. If we don't see anything on your application at all, and we don't see any work history, then we kind of wonder, well, what were you up to? So your work history is relevant. If you had a year off, if you had multiple years off, if you had a completely different life that you had for years, we want to know what you were doing. When it comes to undergraduate experiences, people always wonder, how much should I include and what should I skip? So any sort of scholarship that you got, any big award that you got, any preclinical stuff that is pertinent or major, definitely include it. And that also includes if you had a different, life before medicine. What you should not do is don't put languages that you are not actually fluent in. I'm telling you, it will come back to bite you. We always find out. There are people that will interview you in that language and figure it out, and you're going to look silly. Just don't do it. So there's going to be a lot of opinions about this one, but as far as the photo, and we can get into other opinions when we get into the chat later, but For me, I understand why people may be concerned about being profiled in some way, but we use it for a bunch of different reasons. One of them is that we may interview you in October or November. And when we're doing our rank list 2, 3 months later, we have to remember who you are. And, a lot of you know that as EM people, a lot of us are visual learners. So even though I keep a very detailed list of notes of everybody that I interview, there's something that jogs your memory about seeing the person. And also because a lot of places are doing Zoom interviews, we just need to know we have the right person. Because if you've been Zoom bombed, then you get it, right? SAM was Zoom bombed last year. I heard that was kind of interesting. I didn't get to see that one, but helpful to know who you are. And it's just really helpful to jog our memory so we can remember months later, oh, it was that guy. Okay. So I'm going to spend more time on the personal statement because it seems to be the part of the application that everybody spends the most time on, but it isn't necessarily the most important. There are a lot of really useful things to know about it. So I'll start by saying, don't drive yourself nuts. People really obsess over these, and in a lot of cases, it's just not necessary. In an overall sense, it's not the end all and be all of your application, but it is a good way to tell us a little bit about the person we're about to meet. A lot of us are not reading it until the night before we meet you, or maybe even a few minutes before. It really depends on what our system is. At least for me, for the most part, it really doesn't figure into my initial application review when we're deciding who to invite, unless there's a red flag somewhere and I'm looking for an explanation. If something's missing, if there's a break. I love that Eric is nodding because it's making me feel great and reinforced. So if I don't see a great explanation there, or I don't see something in the dean's letter, I may pass on the application because I'm thinking, well, something's up and they're not explaining it and I don't want to figure it out. So my first piece of advice is address the red flags. If you had a blip in the past, talk about it. If you're unsure how to word it, ask your advisor, ask your dean. It is worth knowing how it will be worded in your dean's letter. They have really political ways of wording it. If the dean's letter says that you were having academic difficulty and you say that you were taking a great research opportunity, something's going to smell funny. And it's best to just be honest because we're much more likely to trust what you say if it makes sense. And honestly, if you're more honest and you're open about it, it's easier to just have a discussion because then we know that you can deal with it going forward and that the same thing might not happen again in the future. Another big one is feedback. Ask people to review your statement and see how you come off. I will use an example from this past year where we read a statement from someone who, from the tone of his statement, sounded like he thought he invented medical Spanish. He did not. There's a large portion of the population where that is their first or second language, and please don't talk like that. And I don't think that he realized how it came off. I think in reality, he was just really psyched about it and he was excited to have an extra skill, but it came off in a way that was kind of pompous and really rubbed everybody the wrong way. It's really all about your tone. So it's best to have somebody who will be completely honest with you, maybe not your best friend, because they're going to say, oh yeah, it's great, really good job. You want somebody that's going to say, look, you sound a little weird here. Maybe you should reword this a little bit differently. But you want like a third person who not necessarily feels like they have to compliment you. So my next, it's a little bit of a pet peeve, I think, of a lot of us is don't force a metaphor. If there's a reason that something is really important to you and it works well, great. But trying to compare EM to golf just to make it work falls flat and it doesn't add anything to your application. What we really want to know is, who are you? Why is EM for you? And why are you a great fit for us? Why are we going to be interested in you? Because I don't really care about golf. I care about you. Don't be someone that you're not. The best statements are the ones that give you a little insight into the person so you know who you're going to be meeting the next day. You can put a little bit of your personality in there. If you're an introvert, be an introvert. Totally fine. I'm an introvert. I get it. You don't have to be charismatic, something that you're not. What not to do? Lots of things. So do not overstate your importance, please. It comes off really badly when you say that you intubated the patient and you rushed them to CT and it sounds like you were completely unsupervised, because I'm more worried about the place where you rotated. Why are they letting a student do that? Please don't give a laundry list of things that you want in a program. This is a trend that came out the last 2 years. I want this and I'm looking for this. And it sounds a little bit entitled, but also what program is going to fit that list? They're not. This is a match. The match has its own sense of wisdom. Go with it. But if you match into any program, this is a competitive specialty. You are lucky to train there, and it is a privilege to be part of this specialty that we are all part of, that we all care about. Another thing is, don't say that you need a level 1 trauma center with high volume when you send it to a small community program, right? We get this all the time. And the first thing that we think is, well, are you applying to us to fill your interview schedule? Because it sounds like you're not really going to be interested. So just remember that if there's a particular reason that you applied to a smaller program because you wanted to check it out, it's cool. But remember that if you're saying, I want big cases, I want all this trauma, it's going to make us wonder. And the other thing is, don't be negative about patients. Referring to people as drunks in your personal statement doesn't sound good. And believe me, it happens. Even patients that you don't like, they're humans. Even if you don't like those humans, they deserve to be treated as humans. And it doesn't sound great as a future doctor to say something like that. So things to do, read it out loud at the end. I highly recommend you do this because probably if you're anything like me, you edited it so many times that you don't even realize there are parts that don't fit together or flow anymore because you are 20 versions down and still going. So at least mine, when I read it at the end, I realized that one chunk jumped to the other and it just made no sense. Explain all leaves of absence. Make sure you know what the dean's list is going to say. Remember, mismatches sound a little bit sketchy, but this is your place to introduce yourself to the program, and that's what we're looking for. And as far as tailoring it to certain programs, there's lots of different opinions about that, but it's not worth driving yourself crazy about. We get that you can write a different sentence for every program and send it to them. It doesn't really matter. But if there's something that you really want the program to know, like why you're interested in them in particular, knock yourself out. It's not totally necessary. So don't spend tons of time on it. And most importantly, don't stress too much. This is where you're introducing yourself. But again, it's not the end all and be all of your application. It's just a part of it. Any questions? We're going to keep them for later.
Thank you. Another roaring round of applause. I'm just going to give it. I know everyone's applauding.
One person.
Woo! Some really good points there, and I'm sure there'll be a lot of questions later on during the Q&A session. I actually have some in my head that I'm going to ask you later, so be ready for that about the personal statement. But yeah, some really great
Sports
points.
Analogies.
Yeah, exactly. Oh my God, so many. But with that being said, some really good key points. The first one was it's really not as important as you may think, right? And so we'll maybe get into that later in the Q&A session. I'm going to maybe ask our panel if/when they look at the personal statement, what they do with it, at what point in the application process. And then again, a huge opportunity to address any potential red flags or quote unquote weaknesses on your application, right? And that kind of dovetailed in what Dr. Fernandez said next. Have somebody else look at your application and your personal statement, because maybe you don't think you have a weakness and someone's like, oh, you better address this in your personal statement, right? So another opportunity. And then lots of do nots, which I think we all agree with. And we can go over some more of that in the question and answer session later. So thank you again, Dr. Fernandez. And we'll take a 2-minute break because I have to get my slides ready because I think I'm next. So give me 1 minute. Whoops, hold on. It's hard running Zoom and doing this at the same time. There we go. All right, can everyone only see my slide? Or are you seeing some other stuff? All right, I see James, I see Liz, thanks. All right, so I'll introduce myself again in case anyone missed me. I have to move all your faces around out of the way. Hold on 1 second, no offense. Okay, I'm Eric Steinberg. I'm the PD at St. Joe's in Patterson. And I'm going to kind of go over the numbers and the studies that we have. They're not great. The studies are all survey based, but the numbers kind of speak for themselves. So it's not the most exciting topic, but it's really important because the landscape of emergency medicine and the application process has changed over the past few years. And the question that I get over and over again, at least 20 times a year, is this, right? Am I competitive, right? And as you're going to see tonight, there's several factors that can impact your overall competitiveness. And so we're going to take a look at some data from the NRMP. The NRMP is the organization who runs the match. And we're also going to go over some of those survey studies of EM residency programs. We've already seen a couple of those slides, so some recurring themes tonight that are really important. So first things first, take a deep breath, because every applicant has their strengths, every applicant has their weaknesses, but a vast majority of you fall into the competitive category. So it's likely that if you're here tonight, you're probably competitive, and there's a lot of spots, and that's a double-edged sword. But for you right now applying to emergency medicine, that's a good thing that there's so many spots available. Okay. So before we go into competitiveness, we're going to take a look at some cutouts from this year's match data that just came out. Okay. So this is match by applicant type, and move your eyes down to the last row. And you can see here this year, there were over 2,800 positions available for EM, right? So 2,840 and 2,826 of those were filled. So out of almost 3,000 positions, only 14 had openings. And I think about half of them was actually a new program that didn't have the ability to rank any applicants. So single digit openings, 99.5% fill rate. About 2/3 of the people who matched were US allopathic seniors, about a quarter were osteopathic seniors, and about 5% were US international medical students, IMGs. So now we're going to look at this last row again, and those are the number of positions offered over the past 5 years. And emergency medicine positions continue to increase, and they're offering about 200 more positions than just last year, and it's up by a staggering 40% from just 4 years ago. So the number of positions keep getting bigger and bigger, larger and larger and larger. And now this sounds promising, I think, at this part in your career, because more positions available means more opportunity to match. And although that may be correct, as we know with the recent workforce study that came out, we actually might be oversaturating the market. So on the back end, it actually may be more challenging to find a competitive career once you graduate. But don't worry about that now. Let's get into residency first, okay? That's a discussion we could save for later. So the spots are just continuing to increase. All right, this table is titled Choices by Specialty. And this simply shows an overwhelming majority, 91%, I think to be exact, of people who apply to EM only applied to EM and no other specialty, all right? And then most other people applied to 2 choices, with EM being 1. So 9 out of 10 people who applied to EM applied only to EM. Okay, and this table shows us percentages for matched and unmatched applicants from MD and DO seniors who ranked only EM. And if you can, shift your focus all the way to the bottom right. So emergency medicine, that percent unmatched column that you see, those last 2 numbers in the bottom right. Okay. And overall, about 1 in 11 US allopathic seniors who applied for EM went unmatched. Okay. So about 9%, and about 1 in 8 US osteopathic seniors who applied to EM went unmatched. Okay. So about 9% of allopaths and about 12.5% of osteopathic students did not match EM for those who only applied to EM. Okay. When we get into IMGs, the numbers are a little bit different. About 1/3 of US IMGs who applied to EM went unmatched. Okay. It's a pretty big number, and over half of non-US IMGs who applied only to EM went unmatched. Okay. So depending on where you go to school, think about these numbers in determining how many specialties you're going to apply to, and if applying only to emergency medicine is the right choice. Okay. There's, again, a lot of things we're going to talk about today that go into whether you're competitive or not, but these are the numbers. So I'm not trying to scare anyone, but I'm trying to give you some perspective with some real objective data. Okay. So now that we looked at the numbers, let's define what competitiveness truly is, and what it actually means. And when I say competitive, I'm referring to the ability to match, right? That's what the end game is here. And with an overwhelming majority of circumstances, that directly correlates with the number of interviews you land. So when I'm talking about competitiveness right now, I'm talking about how do you nail X number of interviews to be able to match. So do board scores and grades and class rank and the slows and the letters of recommendation matter? Of course they do. But having some insight to where you stand compared to your peers, well, that's critical for coming up with your strategy, which Dr. Desai is going to talk about next, okay? So let's talk about a few major concepts based on the data. Some of this is going to be repeated from before. But first, I think it's imperative that you assess your competitiveness on 3 different scales: local, regional, and national. So keep in the back of your mind, how far am I going to apply from home? Or am I restricted to a very small geographic area? Because the further away you apply, there's going to be different factors that are going to influence and have an impact on your ability to match. So locally, your competitiveness is probably most influenced by personal relationships. So if you were a scribe, or if you shadowed, or if you performed research somewhere that has a program and they absolutely love you, this is going to be significantly more impactful than your step 2 score, or how you did on your dermatology elective, for example. So that can only extend so far, right? If people know you and they love you, that's always going to be much more important than a borderline or a mediocre step 1 score, for example. Okay. So locally, personal relationships matter. Think about that when you're trying to decide what to do with your free time. Common theme: the slow is everything, right? The letters of recommendation. And regionally, your competitiveness is most likely going to be influenced by a letter of recommendation generated from a rotation within that region. So for example, if Jenny or Pick or Liz or Frosso, anyone who I know the name, if they say, well, we really want this student in our program, well, I'm not even going to look at the rest. Of course, I'm going to want that person too, right? It's a small world. So PDs and APDs and clerkship directors, we all know each other and we respect each other and we trust each other's judgment. And we're also a bit competitive too. I don't know if that's a secret or not. So if one of our colleagues wants you, you're damn right we want you too. And so that ripple effect is going to extend, and it's definitely going to extend regionally. And in a 2014 survey of program directors, 97% of respondents said that knowing the person who wrote the letter of recommendation increases the value of decision making. So it really makes a difference. And finally, on a national scale, it's the usual stuff, which we're going to get into in a little bit. The slow is always going to be the most important, but then a holistic approach to the application. So they may not know who signed the slow or the place that you rotated. They're going to go towards more classic objective data. Okay, so take a minute when you're making your application and when you're thinking of where you're going to apply to know how competitive you are on these different scales. Ooh. All right. Next, let's talk about making the first cut. Many programs have no choice but to employ certain filters to their ERAS application. And because logistically, it's impossible to interview everyone. Some places got a few thousand applications for like 8 spots, right? So when you're receiving thousands of applications for a handful of spots, there are filters that are employed. So to be clear, this means that some applicants may never have a human being looking at their application because it's just impossible to look at all of them. So I'm going to go over some of the most common filters that are being used, okay? And so this is a graph of which percentage of US EM residency programs use specific filters. And over half of the residency programs responded to this survey. I think we did too. And so it's a pretty good sample. So starting at this top blue bar, non-US IMG, right? So if you're a non-US international medical student, you either have to be absolutely exceptional, or if you're not, you have to be sure to target programs that have historically matched you in the past. And we're going to talk about that a little bit more later on. So that's the most common, right? With over 60% of respondents saying they use that as a filter. Move down to the red and orange bars right below that, and that's step 1 failure and step 1 minimum score. And these are sure common, right? With about half of the programs using these filters, but there's 2 major caveats here. The first one is that we know that step 1 score really has nothing to do with how good of a doctor you're going to become. But we do know that it probably does predict your ability to pass the boards or pass the test at some point. And that matters too, right? The second major caveat, as of January 26, 2022, step 1 is going to be pass fail. How can they? The humanity, we have less numbers to go by. We have to actually get to know people more. But we do need some sort of objective data points to filter out the applicants, right? So simply move your eyes down to those 2 next rows, the green and the purple one, And you'll see those are step 2 failure and step 2 minimum score. And so, as I just mentioned, with step 1 going to pass fail, we're much more likely to have even more of an impact or more of an influence on step 2. We're going to put more weight on step 2 starting next year than ever before. And I can only speak for myself, but I know other PDs like me have already been weighing step 2 more than step 1. But I think this is going to be even a more common trend as step 1 becomes pass fail. And so I want you to keep this in mind, because more and more PDs, I think, are going to want to see step 2 scores to fully consider applications. And I know some students are getting advice to defer step 2. They do really well in step 1 because they don't want to weaken their application. I actually think that's bad advice, but we could talk about that at the Q&A session. My advice to you is to take step 2 and focus on that. And then next, the bottom dark blue bar we see is about 10% of programs use a filter of previous residency training. Now, first you might think, that shouldn't be a big red flag, but unfortunately it is. And the reason why it is because it's money. It comes down to funding. So the number of years you get funded as a resident is based on the program you originally match into. So if you match pediatrics, for example, and you want to switch to EM, you will only have 2 years of funding attached to you if you already did a year of pediatrics. On the other hand, if you match surgery, you get 5 years of funding. And so if you did 1 year of surgery and decide to flip over, then you get funding attached to you. So just something to think about for any of the participants here that are already in residency. If you're applying to a program and you initially matched into a 3-year program, make sure that you ask the program directors and the program coordinators that you're applying to if you will be considered for a position. And then finally, the same thing with previous training. The natural thought for us as program directors, well, what's your commitment to emergency medicine, right? Is this something you really want to do in the first place, or was it just you didn't get in the first round? And so that's where the personal statement, again, can be very important, because you could address that in your personal statement. Okay. So those are the filters. Pick had this other half of the slide up before, but this is a recent survey of PDs, and they asked what factors are important for an applicant to land an interview. And they rated each factor from 1 to 5. And so here are the ones that were above a 4.5. And guess what? Other than not failing your boards, it's all about your performance on your clerkship. It's all about that slow. And we're giving you some spaced repetition because you're going to hear it again today. It's all about that slow, that letter of recommendation. So whether it's your home rotation or you're doing an away rotation, it is the single most important piece of your application. So do all those things that PIC told you to do. Don't do any of those things that PIC told you not to do. And your slow is going to pay dividends, because that is the first thing we look at. And it's the thing that we weigh the most heavily. And it's great that the slow has so much weight in your decision to be interviewed, because it reflects your clinical skills, your interpersonal abilities, and your emotional intelligence. And it's a far more realistic predictor of your success on a board score. But guess what? The odds are is that you'll never get to see it, right? Almost every single student waives their right to see their own slow. So how do you know how you performed on your rotation? And some advice for you for that. So what not to do? Don't ask, hey, can I just look at my slow? Can you tell me what grade I got? Let me just peek at it real quick. I won't tell anybody. Believe it or not, we've been asked that. What you can do is say, I'm really interested in how my overall performance was. Are there any specific areas for improvement? How did my performance compare to other rotators that have matched, right? Now, an overwhelming majority of places will have an exit interview or some sort of meeting at the end, and they'll give you some sort of summative assessment with you at the end of your block. If that's not the case, which does happen, be sure to request one. That is something that you deserve. This is not being overbearing or too aggressive. That is advocating for what you deserve, which is feedback on how you performed on that rotation. Now, if you're at risk, right, if you have low scores or there are other red flags that were discussed on the filter slide that we went over, specifically ask your letter writer if they will write a supportive slow. Okay, that's something that's okay to ask, because this at minimum will give you an indication whether it's going to be a slow that you actually want to put in your application, and might give you an indication of whether emergency medicine is the right specialty to apply for, right? It'll at least open that dialogue to address your competitiveness, okay? So don't ask to look at your slow, but you definitely 110% deserve feedback. So after the questions, am I competitive and how can I make myself more competitive, are the questions that start with this. And we kind of went over this a little bit. How important is extracurriculars, right? And I'd argue that that's moderately to very important. And the reason is because most of our applicants are smart. Most of them work really hard. And we want to know what you're doing on your free time, right? How are you prioritizing your free time? Are you sitting at home and watching Netflix? Or are you doing community outreach, tutoring, volunteering, something at a free medical clinic, something interesting, right? Those are things that actually matter. Research experience, I'd argue, is moderately important because in general, the amount of research experience is not terribly influential in determining your competitiveness. However, this will vary, and it'll vary a fair amount from program to program. So not surprisingly, programs with prominent research programs and funding will likely place an emphasis on this while you're a resident. And traditionally, four-year programs place more of an emphasis on research experience than three-year programs. So keep that in mind. And then finally, work experience, which we talked about. And I'd argue it's only somewhat important in determining your competitiveness based on the studies and based on opinion of the people we talk to. And it doesn't really help you in obtaining the interview, which is the most important step, but it may be influential as a launch point for discussion during your interview. So if you're a scribe or if you're an EMT, that's great. It's probably not going to help you much in getting the interview, but once you have the interview, it's a great launching point for discussion, and it could definitely help you move up on that rank list. All right, so let's recap and summarize the concept of competitiveness because it'll get to the final question I get asked all the time, and that is, how many programs should I apply to? And there's so many confounding variables that may alter the response to this question, but in general, I think this is a great summary slide. So the first caveat, as we discussed, is step one will be pass fail. So we're going to place more of an emphasis on that step two column. And so you're marginally competitive if you squeak by the steps, right? If your slows aren't supportive, if you haven't high passed or honored your EM rotations, and if there's any other red flag characteristics on your application. And again, that's why it's good to have somebody external take an objective look, whether it's an assigned mentor at med school or somebody else that you trust, to take a look and give you an idea of how competitive you are. Now, less competitive, again, don't worry about step one too much, but a lowish step two, you only have one letter of recommendation that's supportive, maybe a pass or a high pass on your EM grades. 35 to 45 applications is what we're looking at, okay? That's a decent amount. And we could talk a little bit later at the Q&A session. People have questions about the virtual interviews because more and more people are applying to more and more programs just because it's easier. Now, competitive is in this range, right? So you have really good board scores. You have two slows that are supportive. That's usually high pass or honors. We see on your application that commitment. What are you doing on your free time? That's useful. You really need 20 to 30 applications max there. And if you're very competitive, you have ridiculous board scores, really good slows, great grades, you probably only need to apply to 15 or 25 applications. And the rule of thumb, and I think Dr. Desai is going to go into that a little bit later, you probably only need about 10 to 12 interviews to have a really good chance of matching, okay? So none of this is a big surprise, but in terms of the question, how many programs do I need to apply to? If you're less competitive, we're looking at close to 50. If you're competitive, about 30. If you're very competitive, probably around 20. And last but not least, some special considerations. First is for my Caribbean med student friends. And yes, this is what I picture when Caribbean med school is going to be like. I know it's exactly like that, right? And also for my osteopathic friends, look, this is what we do as osteopaths. We're doing some manipulation on the beach, right? Some specific advice for you because you have bigger hurdles to overcome, so to speak, in certain ways for different reasons, right? Sometimes your schools don't have home rotations. Sometimes your schools haven't had a resident at that program to represent your school. Some of these schools are newer, right? So my advice to you, osteopathic students and the IMGs, but really this pays off for everyone, but it's specifically you. First, go to your advisors, your deans, whoever has a list of previous match results for the past 5 to 10 years, and see who from your school match the EM programs that you're interested in, right? You can get that list, all right? You can talk to people who know who from your school got matched into EM, and then contact them. Contact every single one of them. Alumni from your school will typically feel more motivated. They'll probably even feel obligated to help out a fellow grad, right, from the same school as you, especially if you're interested in their residency program. And then you get some dirt, you get some insight to what the residency program's actually like, okay? Get that list of the past 5 to 10 years of match data from your school, reach out. And second, this especially goes out to those who are geographically limited. Reach out to each program coordinator individually. Sites like Emra Match or Frida on the AAMC site, they're good, but they're not necessarily updated on a consistent basis. They're getting better. But if a program coordinator writes back to you stating, oh yeah, we accept IMGs and we always have osteopathic interviews, that's obviously reassuring. But if they say they don't consider you, well, you just saved yourself some time and money. And I'm not saying don't apply, but don't expect, mountains to be moved if they're saying we don't consider you, because it's unlikely to change. And if they don't get back to you at all, well, then you may want to consider that as an indication of how you'll be treated if you were to be a resident there, right? So reach out to the people who've matched there, reach out to the program coordinators. You got to look out for yourself. You really can't be too aggressive here unless you just keep emailing people despite not getting responses. And that happens quite often as well. All right, so to summarize the key points, most of you are competitive, right? There's a lot of spots out there. So the odds are that you are competitive too. In general, the slow is the king, the slow is the queen. It carries the most weight. Everything you do should be focused on killing that slow and getting some good feedback. And last, and probably the most critical point, you have to be honest with yourself, right? I gave you some numbers, I gave you some information. Use it to have an honest self-assessment. We're not really good at doing that, so have somebody else assess you, because not only will this determine if you should apply to emergency medicine, but also tell you how many programs and how far your reach should be. Big thanks to Emra. I really ripped off a lot from their student advising guide. If you haven't seen it, just type in Emra student advising guide and you'll be like, wow, Steinberg literally copied and pasted from there, but that's okay. It's a great free resource with tons of good advice and information. So thanks for your time and thanks for considering our amazing specialty, which is the best specialty in the world. Now, last time I finished a presentation, I ended the meeting for everyone and that was really bad. So let's see. Okay. Great. So we'll take any questions and we'll save them for the end. Hopefully that was helpful. And let's take a solid 7-minute break so everyone could hydrate, caffeinate, go to the bathroom, do what they have to do. And we'll come back at 7:15 for Dr. Desai. Sound good? All right, we'll see you at 7:15. All right, welcome back, everyone. Hopefully you've had a good time so far and we've learned a lot. Have a lot of discussion for later, the Q&A session. Up next, I'm going to introduce Dr. Riddhi Desai. So she is an incoming chief resident at St. Joe's in Paterson, New Jersey. She's also our new All-New York City EM Fellow. She's a great mixologist, and she created the Beer and Banana Olympics for our residency retreat, which I think has been her greatest accomplishment thus far. So we have a real actual resident to give some advice. So without further ado, Dr. Desai, floor is yours. Thanks for joining us tonight.
Thank you for having me. All right. Hi, everybody. My name is Riddhi Desai. I am a second-year emergency medicine resident training at a level 2 trauma center in North Jersey. And these are my day ones, my confidants in the ER, our first saves, our first losses, we're all with each other. And you all are 1 year away from standing with your team, your fellow residents who are completely different, but somehow also the same, a little too neurotic at times, dysfunctional at baseline, but the people you will call first when shit starts to hit the fan. You may feel far from this moment, but trust me, it is much closer than you think. I remember so clearly how overwhelmed, unprepared, and lost I felt for residency application and interview season. So you're already 10 steps ahead of me when I was in your shoes, just by being here today. And after we talk, I guarantee that you will leave with a great approach to interview season with strategy. So today I'm going to be discussing scheduling interviews, interview prep, how to get to know a program during pandemic times, post-interview communication, and how to divert your mind after your rank list submission. So let's dive in. Scheduling interviews. How many? How many am I supposed to schedule? This is always a question that medical students ask themselves, because you know what? At the end of the day, we're all overachievers. And after working this hard for all these years, we want to give ourselves the best chance to match, right? So how many interviews do you actually need? So I pulled some of the data from the NRMP 2020 and 2021 match. And if you look at each graph, it pertains to the USMD, the DO, and IMG graduates. And I also added a red line in the middle, and all of them are in the same place, which means that if you rank 12 programs after going to 12 interviews, that means that you have a 95 or greater than 95% chance of matching at one of the places that you ranked. And those are some pretty good odds. And everyone has their own magic numbers in their head of how many interviews they hope to have. But just remember, quality over quantity. When you're applying to residency programs, I highly recommend opening up the EMRA map and looking at where all the programs are scattered over the United States, just like Dr. Steinberg mentioned, and then narrow it down from there. Based on the program's requirements, the location, is it academic versus community? Create a list of 2 or 3 things that are really important to you in a program and jot down those programs that match what you're looking for. And it's pretty easy to apply to 70 plus programs online. They're all through ERAS. Most of them require the same documents, but here's the hard part. Can you actually genuinely see yourself at all of those programs? Well, the answer is most likely no, and that's okay, but you have to start off with a broad search. And at the same time, you don't want to fall into the trap of reputation or big names. It's really about where you see yourself thriving the most, and that might not be one of those programs. So when you start to receive interview invites, and it's a program that you're not so sure about anymore, your immediate thought is to accept the interview, and you should. This means that they really liked you on paper, and they want to get to know you more. Many programs get over 1,000 applications, and they usually only interview 10 to 15% of those applicants. So you getting an invite means a lot. Just know that. And in the beginning, it makes sense to accept all your interview invites, right? However, I urge you to take a second look at the program website one more time and any other information you might have about them, and think about all the characteristics that you're looking for in a program, and ask yourself, does this align with what I want? And if you feel that you don't have too many interviews and you need to broaden your quest, then you should 100% accept that interview and try your absolute best. However, if you have plenty of interviews and you really don't see yourself going to this program, don't waste your time and don't waste theirs. And on the other hand, you may have a lot of interviews, but you still want to see what that program has to offer because maybe you'll learn that it is what you're looking for. Then accept the invite. But again, remember, quality over quantity always. Even if you have 9 interviews and you kill it on every single one of them, that's much better than being overwhelmed by 20 interviews, being exhausted from the travel, having to meet new people so frequently, making conversation. Did I mention so much conversation? And as a result, after a while, that can start to hinder your interview performance. So you should do what's best for you, but just remember those odds and that less is more sometimes. The magic number in 2020, 2019, and even 2021 was 12 contiguous ranks on your rank list for a 95% chance of matching. All right, so you applied through ERAS, and now it comes time for your interview invites. They usually start to roll in around late September, early October. No matter what you are doing, whether you're on a shift, take 1 minute to step away and accept the invite on your phone, unless you're doing something life-saving. As soon as you're done with your life-saving task, you should go and accept the invite. Attendings and residents will understand this because we went through the very, very same thing and we want you to succeed. Interview dates fill up very, very quickly and many times within minutes. And you might be left with a day that you're already scheduled to work or you have another interview. So keep a calendar on you with your shifts and your work days noted so that you can schedule your interviews on your days off very efficiently. And we all have this notion that we want to be remembered when we interview. So maybe we don't want to interview too early in October, and maybe we don't want to interview in January because it's kind of late in the season. But guess what? If you leave a good impression on a program at your interview and you continue to casually keep in touch with some of the residents or attendings that you met and you really vibed with, you will be remembered no matter what time you interviewed, and they will rank you. So the goal isn't to schedule all of your interviews very early or late in the season, but if some of them end up during those times, that's completely okay. Don't feel bad about it. It's still an interview and you're going to kick butt. So now you're a scheduling master, you're getting invites, you're picking your dates, and everything is working out just how you planned. Your first interview is coming up in 1 week. So how are you preparing for your debut? It feels really overwhelming when you're trying to start the prep, but you should not be practicing too much. So here's what I recommend. Pull up your CV and run through the list of everything you've done. After all, you're in medical school, you're an overachiever to begin with. You're applying for residency. You've done a lot of things over the past few years that you should be really proud of. And at times we forget some of our accomplishments. So it's a good refresher and a great place to start. The next thing you can do is Google emergency medicine residency interview questions, and you will go through this rabbit hole and find so many documents and sites with hundreds of questions. And you're gonna feel like you need to answer every single one and write a paragraph for all of them, but don't do that. Just use them as an exercise. When I was going through the whole interview season, I would find a link, click on a few questions, and then write down 3 or 4 bullet points that I wanted to get across in my response if I was asked that specific question. So I would do that for maybe 2 or 3 questions at night before I went to sleep, just to have some thoughts in my head of what I would want to say. And it's very easy to tell when residency candidates sound too rehearsed, and it takes away from you being genuine. No one knows you better than you, right? So the focus of your interview is to highlight how great you are and what you learned from your experiences, what led you to this seat today, and why that makes you the best candidate for the program. And you don't have to study. That's just something that comes from within. So when you're prepping, I recommend emailing the current chiefs or program coordinator to see if you can have the email addresses of some of the residents, whether it's an intern or a third year, and ask them some questions that are important to you, right? What is your schedule like? How is the teaching? What is the vibe of your program? Those are really important things to know about before you jump in. Research the residency's strengths, right? Or specific programs that they offer, and bring up how you hope to benefit from these programs or how you hope to contribute to them. So here's an example. If an attending, were to ask me this question, I would say, Oh, Dr. Steinberg, it's so funny that you asked me that because I actually reached out to Jess, one of your interns, and we had some really great conversations about this program. She told me that a bunch of the residents participate in a Stop the Bleed campaign to help people in the city learn how to recognize life-threatening bleeding injuries and act quickly to control it while they're waiting for an ambulance. And I love that because in medical school, I went to grocery stores with my classmates in our community, and we would check the shoppers' blood pressures, their blood sugars, and provided them tips on how to modify their diet, what lifestyle changes that they could make to improve their health. And I love that your residents take the time to volunteer in the community outside of clinical shifts. It really means a lot to me as a future physician, and it's really something I hope to continue to participate in to make a difference in the town that I'm serving. And as a physician, I want to be well skilled in having conversations and qualities like that with my patients. So this highlights a few really important things. One, you're taking interest in the program beyond their website. That shows that you really care and you want to be there. And you're taking time out of your schedule to speak to residents and get their perspective. Two, you're relating it to you and what you have accomplished. So that tells them kind of something that they wouldn't have known about you otherwise. Three, you're being vocal about what you hope to continue doing in residency and how you hope to contribute to something they offer and are really proud of. That says a lot about you in just one response. So remember, you don't have to list off all the things you've done on your CV. They already know that information. It's your entire application is right in front of them. And they want to know if you're a good fit for the program. Are you genuine? Are you truly interested in being at this program? Or is this just another interview for you? Okay, so now you rocked your interview, you're feeling great. And even though you said thank you to the program director, the attendings who interviewed you, they slipped you their business card and it has their email address, you send them a thank you email after that, but now you're done with all of your interviews and you know your number one choice. Do you email that number one program to let them know, or do you not? So here's a draft of my post-interview communication email to residency programs, which was stolen from Grey's Anatomy. And this is what I wanted to write. And I'm sure many of you will want to also, because what else can you possibly say? You put it all out there on your application. You look amazing on paper. You were incredible in person at your interview. And now you have to write an email to let them know how much you want to be there. Well, guess what? Post-interview communication is not required by any means. So let's change our perspective on this. The way I thought about it was, I'm going to send this email to my number one choice because if I don't, I am not going to be able to sleep at night for the next few months until match. I'm not sending this email to elicit a response, and I'm not writing this to get them to move me up on their rank list. I genuinely want them to know one more time that based on what I learned about the program, my interactions with everyone there on interview day, my audition, I would be honored to match there. And regardless of what happens, I'm grateful for even being considered. With that said, do not feel obligated to send an email afterwards to say this. You can just say thank you. It was so great to meet everyone. Thank you for considering me. You may not receive a response, or you might get a generic response because some program directors feel that they don't want to say anything that's going to influence your decision, which is very respectful. What's important about this is that you wanted to get a point across to your number one program, so you did. I never received a response after I emailed my number one program, but initially I was anxious about this. And after the match, I realized that it didn't matter, and I understood why my program director didn't say anything back. So now I have one piece of advice. Put all of your energy, after you've submitted your rank list, put all of your energy towards matching at your dream residency, your number one choice. Throughout my days on rotations or at home, if I started to feel anxious in a bad way or really uneasy about the match, I'd channel that energy into positive energy. I'd close my eyes for a few seconds and just imagine myself as an intern at the program that I'm at right now. And I'm not getting my hopes up. I'm just channeling my energy towards something that I really want. And every single night before I went to sleep, I'd say out loud, I cannot wait to be an intern at XYZ hospital, while imagining myself walking through the doors of the ER, putting on my white coat, and sitting in the same seat as the current residents. I gave myself those reminders as many times as I needed throughout the day. And as the time came closer to match, it was a little more frequent. I say this because I truly believe that the universe works in our favor and everything happens for a reason. There were some programs that I thought would grant me an interview, and I went crazy wondering why. I did well in med school, my boards were fine, my CV was packed. Why not me? But looking back, I wish I didn't even spend an ounce of energy on those negative thoughts. As much as you matching residency is based on your hard work in medical school, outside of school, merit, there's also a component of chance. So keep that in mind and know that you did everything that you could have to set yourself up for success. So now that you're done, go and travel. Make a list of things that you want to do before you start residency and actually do them. You don't have to wait until graduation if you're done with your rotations. Take time for yourself because you probably haven't over the past few years. And celebrate. Even if match is a few weeks away, you sacrificed so much to get to this point. Be proud of how far you've come and give yourself a break. Because before you know it, you'll feel the way you did before this talk, overwhelmed, uncertain, lost, all over again. So this is a picture of me during my intern year at the end of a really long day in the MICU. After resuscitating multiple patients, placing a whole lot of lines, getting bodily fluids of all sorts all over me, not a single person told me that my hair looked like this all day. I teared up in the bathroom when I saw what I looked like, and a storm of emotions rushed my body. And then I started to laugh. And I took this picture to remind myself that I survived this day. And after that, I walked back to my desk and wrote all my notes with my hair still looking like that. I felt, again, overwhelmed, unprepared, exhausted, and unsure where to even start. And these feelings may all be too familiar to you right here, right now, as you approach this daunting process of applying to residency. Well, guess what? That feeling never goes away, but you learn to handle it better every time. You've worked incredibly hard, sacrificed a lot to get to where you are today, so embrace it. It's okay to feel lost. It's okay to be unsure, but continue to be proactive like you are by being here today. Seek advice from your emergency medicine colleagues to be, and strategize well because we're here for you. So just to reiterate some take-home points, remember, quality over quantity, always. You don't need to have 20 or 30 interviews. That's not what's important. You just need to make sure you kill it on every interview that you go on. 12 ranks, if you go to 16 interviews, but you rank 12 programs on your rank list, that means you have a 95, at least a 95, if not greater chance of matching at one of those programs. Stay organized when you're scheduling your interviews and get to know programs beyond their website. Message the chief residents, get their email address, message the program coordinator, ask to see if you can do a second look. Be genuine and less rehearsed. Remember, no one knows you better than you know yourself, right? So you shouldn't have to study what you've done. You already know. Post-interview emails. So post-interview communication is not mandatory. Don't feel obligated to send it. And if you do send something, don't feel bad if you don't get a response. That's not why you sent the email. And lastly, divert your mind once interviews are over. Good luck to everyone throughout this process. If you ever need to reach out, I'm always here. Thank you so much for taking the time to listen to me.
All right, another roaring round of applause. I can hear it already. Dr. Desai, thank you so much for that advice. And as everyone can see, you know, there's nothing like hearing it from somebody who just went through it. You did a great job going over the key points, but the one just to emphasize more is do not dwell on the negative, right? If you do not get that interview that you think you were supposed to get, or why did that more competitive place give me an interview and not this one? As much as we like to think that this is a science with their algorithms and formulas and all of that, there's a big part that is chance that Dr. Desai was saying. There's a big part that's luck. Focus on the positive. So thank you so much for that advice, and definitely have some discussion points coming up for the Q&A later for you. Thanks again. All right, moving right along. We're going to go on to the interview itself. So perfect segue for that. How to succeed on interview day. Next, we have Dr. Jenny Beck-Esme. She's the Assistant Program Director at Mount Sinai Morningside and Mount Sinai West, formerly known as Mount Sinai St. Luke's, formerly known as Prince, I think. And she is going to give us some great advice on how to actually tackle the interview day itself and be memorable. Dr. Jenny Beck-Esme, thanks for coming. The floor is yours.
Thank you for having me, everybody. It is great to be here. Yes, right now we're going to start talking about the interview day itself, and there's going to be a little bit of overlap with what Rudy said, which is great because as educators, we love spaced repetition, but let's just dive right into this. So first, I want to start by saying that the interview day is really, at this point, it's a level playing field. So unless this is some courtesy interview that you're getting simply because you rotated out of place, which is probably unlikely. If you've gotten invited to interview, at this point, you've made it through those initial filters that Dr. Steinberg was talking about, and right now you're at a level playing field. I say this because I want you to know that this is a really important day. This is really your chance to shine. And many, if not most, program directors will say that the interview day is probably the most important in terms of match success. This is how we really get to know you. All of that paper stuff, your scores and your CV and all of that gets you through the door. But once we get to know you, this really impacts how you're going to be on our match list. This is 15 or 20 minutes of your life. Granted, it could change your whole life, of course, but that is not a very long period of your time, and you definitely can get through it. We understand it. We understand that it is stressful, and we understand that you have other interviews coming in. And like Rudy said, you want to be able to accept those interviews as quickly as possible, and that you definitely want to be checking your phone all the time throughout the interview day. But just be aware of your surroundings and give those 15 to 20 minutes with each interviewer your entire focus. We don't envy you. We have all been through this, and we don't want to go through it again. So we get the stress that you're under, okay? The other major point I want to say before we get into some of the nitty gritty is that this is as much about you interviewing us as it is about us interviewing you. And I know it doesn't feel this way, but really, truly, the match is weighted in favor of you. So you need to be paying attention at these interviews. You need to be making decisions based on information and gut feelings you get at these interviews. This is your chance, as much as it is ours, this is your chance to see who we are, who these people are, interact with some of the residents, get a sense of who that program director is, what is their mission, what is their vision, see the whole department, provided we're back to bringing people into our departments. And a lot of this really comes down to your gut. Like, did you feel like this is a place that you wanted to spend the next 3 to 4 years of your life? That is your interview of us, and it's really about both of those. So let's just get some of the potential, maybe this is virtual out of the way, and then we'll get into the stuff that kind of applies whether we're virtual or in person. In general, the same rules that I'm going to go over through the rest of this talk are going to apply. So things that you're going to hear me talk about, knowing your application, being prepared with questions, all of that, same rules apply. But there are a few special considerations for virtual. I'm not going to belabor this. All of you have spent well over a year now on Zoom calls and watching television interviews that occur via remote connection. So I know you're aware of Rate the Room. I know you're aware of what it looks like to be on Zoom. So we'll breeze through this. First, same business attire is expected. So don't be showing up at your interviews in more casual clothing just because it is a Zoom interview. Obviously, you can be wearing pajamas on the bottom, but what you're wearing on the top should still look like a business suit, okay? And then in terms of Rate the Room, take some consideration for what is behind you, the camera angle. Can you raise your laptop up so you're looking more directly at the camera instead of looking down? Can you have some lighting in front of you instead of being backlit? All of those things are things that you want to take into consideration and just practice them. Like get mom and dad on a Zoom call, set it up and see what it looks like so that you don't have to worry about that the day of. Okay, but now let's just assume that the world is better by fall and you're all coming to in-person interviews. And if not, the same rules are still going to apply. So first, most interviews in person are going to start the night before with some kind of social. And even virtual interviews at some shops, mine included a night before virtual social of some kind. These are a very good opportunity. And if at all possible, if you're in town to do them, you should definitely go. It will increase the number of residents you're going to get to meet. It gets you a chance to kind of see them interacting in their like own natural habitat, you know, so you get to see how do they like each other. You know, if you show up for an interview social and 4 residents show up, probably not a great sign that they're like terribly happy with their lives, right? So you want to go to a place where a lot of residents want to show up and interact with each other. Get a sense of what the vibe is. Who are they? Do they like each other? But make no mistake, this social is a part of your interview. So people are watching. The residents will tell us how you behaved at that social, who they liked, who they didn't like, who got too drunk. So be careful, ask questions, be fun, but be, you know, on the much more sober side of the evening. The daily schedule for how an interview works, provided we're in person, is pretty uniform around the country. There's a few key elements that you're going to get, and a lot of this carries over into the virtual interviews as well. You're going to get some kind of introduction by a program director, and if it's virtual, that might be something that's pre-recorded that they play for you. If you're in person, they're probably going to sit down and talk to all of you. And then you're going to usually have maybe 4 or 5 interviews. Most of these are going to be with the faculty. Some places will include a resident or a chief resident that's going to interview you. If you're in person, there'll be some kind of tour. If you're virtual, there'll be some kind of virtual tour likely. And usually lunch is included in that. And there's a lot of opportunities to meet people. Residents often will show up for that lunch, so you have time to chat with the residents. So the program director is obviously the most important person that you need to meet. That being said, they do change over time, so don't be panicked if after you match your program director changes. But the program directors have different styles, right? So you want to get a sense of who the program director is that's kind of guiding the mission of the program that you're going to be hopefully matching at. This is going to be who your boss is for the next 3 to 4 years. So really pay attention during that introduction because they're going to be giving you a lot of this information right there up front. There's the possibility that you will be doing group interviews. My shop doesn't do these. We have all individual interviews, but some places will have some kind of panel interview. So just be prepared for that being an option so that you're not overwhelmed and stressed by that as a possibility when you show up that day. And just like our patients in the emergency department, the interview day is a lot of hurry up and wait. It's just the reality of the situation. It is hard logistically, particularly in person, definitely on Zoom, to get consistency in terms of people moving in and out of rooms, how long the interviews take. There's definitely going to be some waiting time, and that will be spent in a little waiting room where sometimes there are some residents that will spend time with you as well. Again, this is part of the interview day. How you kind of interact with other people in this little milieu, in this waiting room, is also being observed. The tour is actually a really, really important part of the day because this area, this space is where you're going to learn how to be a doctor, right? So this is your training environment. Look around, see how the patients are doing, see how people are interacting, see how the nurses are interacting with the doctors. Get a sense of it, because if you can't see yourself in that space, that's not going to be a good environment for you. And remember, again, this is obviously a key take-home point. This is a show, right? So the ER is putting on a show for you, just like you're putting on a show for us. So everybody's trying to be at their best behavior. So just, take everything you see on that tour, knowing that it might not be as perfect as it looks when you show up a few months later. Okay, so down to our first big rules. The first is actually, I take a little bit of a different opinion than Riddy, to some degree here, in that I do think that it is important to practice. And I don't think you should be scripted. So I completely 100%, 1,000,000% over the top agree with her that if you sound too scripted, that is weird and we're going to think you're weird. That being said, it's just as weird if I ask you, so tell me about yourself, and you don't seem to have anything to say, or you don't manage to get me the important parts, right? So there are very specific questions that you know are going to be asked, starting with things like, so tell me about yourself, that you want to have some kind of succinct, clear answer ready to go. You don't want it to sound like you're reading it, particularly if you're on a Zoom interview and you could be reading it. We want to make sure you don't sound like you are reading it. But this is a really important day. So why wouldn't you practice? So I will tell you how I did this when I was both interviewing for medical school and for residency. I would literally walk down the street in New York City like a crazy person and answer out loud the question, so tell me about yourself. And it would be different every time, but I would at least have some kind of very short, minute long elevator pitch for who I am and why you want to meet me. And you can do similar kind of not scripted, but practiced answers to a variety of questions that you know you're going to be asked. In addition, you need to prepare. You need to do your homework. You have to learn about the program that you're going to, figure out what makes it unique. People are going to expect you to have some idea of who we are when you come in. And if you come in acting like you know nothing about us, like we would like to say to you, so tell me about yourself. It would not be appropriate for you to say, so tell me about your program, right? If for no other reason, because you got an introduction to the program by the program director the first thing in the morning. So if you have no concept of who we are when you come into an individual interview, then you weren't paying attention to that. But it's on you to do some of that homework, okay? This also means that you need to know yourself. You need to have prepared enough to understand any problems in your own application. Maybe you failed a course, maybe you had to remediate yourself. Those things are going to be asked. So again, those are things that you want to have a not scripted, but practiced answer to. You are going to be asked questions about those. That is fair game. Be prepared to answer those. Some very basic low-hanging fruits that I do not have to belabor. Don't be late. Like, don't be late. Seriously, 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 don't be late. And if you are late, you have to be so sweaty and disheveled and act like you're a complete panic mess about it, because we need to know that it's upsetting you that you're late. If you stroll in late with your latte and you look like you took your time to get there, we're not gonna be okay with that. So if you're driving, you have to leave much more time than you think you need to leave. If you are taking the train, leave so much extra time because you're taking the train. Get there early and listen to a podcast standing outside on the street corner. That's fine, but don't be late. This is about showing your personality. Okay, so this interview is about you. We have already screened your application. Like, you've made it through the door. Like I said at the beginning, this is now a level playing field, right? We are now talking to you because we want to get to know you. So make sure you are ready to shine and show us your personality. And what this really comes down to, what you're going to hear a lot of EM docs talk about is, does this person pass the 3 a.m. test? And that means, do I want to sit next to them at a doctor's workstation at 3 o'clock in the morning when there's a little bit of a lull and have a conversation with them? Are they nice? Do they carry on a normal conversation? Do they have some interests that they don't have to be the same as mine, but at least are interesting and can be talked about? Are they humble? Are they professional? Are they mature? Are they easy to talk to? Those are all the kinds of things that we're looking for, and that's what we want to see kind of shine through in the interview. Be attentive. So it is super important for you to be listening to everything that's going on around you, paying attention. You want to hear what the PD says in their morning interview or their morning introduction, so you're not asking a very obvious question later to the PD. If you do that, that's a very major red flag. If you want clarity on something, if you say to them, Dr. Steinberg, you said earlier in this that such and such, you have this rotation here and it might be moving there. Could you tell me a little bit more about that? Sure, fine. But you don't want to ask, where do you do your trauma rotation if Dr. Steinberg told you at 9 a.m., okay? And first impressions are everything. So the truth is, the first impression, like the first few seconds of your interview might decide kind of how your interview goes. But not only that, the first impression, meaning how you are in that holding room when the program director comes in to give their welcome, is your first impression with that program director. Okay, so if you are on your phone texting or trying to check another interview while the program director is giving their welcome, that was your first impression, and you're going to be digging yourself out of that rut when you go into the interview with your program director later. So the second someone walks in that room, you're on, your phone is in your bag, and you're paying attention to what's going on in that room. Make sure you have a career plan when you come into the interview. We don't expect you to necessarily follow through on that. If you tell us you think you might want to do a toxicology fellowship and we match with you and 3 years later you decide you're going to do a critical care fellowship, we're not going to hold that against you, okay? But have some idea of something that you want to do. If you walk in and you're just like, oh, I'm interested in global health and ultrasound and medical education and whatever, then we have no idea who you are or where you're going. And in addition, like, whatever it is that you think you want to do should probably be reflected somewhat in the things that you have already done. So if you walk in and tell me you're interested in medical education, but you have nothing that shows me that you've done anything to explore that interest, I might think you're just telling me that because that's what I do and you want to make a good impression on me, right? So yes, and it's allowed to have interests that you haven't been able to explore, of course, but then again, be ready to explain that, right? I'm really interested in medical education. My shop didn't really have a lot of opportunities, but I have been listening to all these podcasts and I'm really looking for an institution that's going to help me develop that interest. Fine. Great. Doesn't matter that you don't have it on your CV. I understand what happened, but don't tell me you're interested in stuff that you haven't explored or had some explanation for. You definitely need to have some questions ready for us, just like Riddhi said, and you can find lists of these online. You can Google, like, what should I ask at a residency interview? And you'll find things. Again, these are things that you can kind of rehearse the night before. I had this like weirdly obsessive binder that I would bring with me to like hotel rooms the night before that I had divided up by programs, and I had notes about each program, and I would just kind of scan through what I was going to ask the next day so that I was ready to go. I didn't bring lists with me into the interview rooms, but I would have it in my head from the night before. The other part of being ready to ask, or the other part of kind of questions, is that we're going to ask you questions, right? So you need to know your own file. Yes, like Riddhi said, you know you better than anybody else. You don't have to study your own file, but make sure you're aware of it. So for example, I had some things on there that were like, I don't know, bench research that I had done as an undergrad, and I couldn't really tell you what it was about anymore. That kind of stuff. Make sure you have looked back at what that is and what your question was that you were asking in that research project that you worked on for 6 months, but you only sort of understood because you were a sophomore in college. All of that, make sure you understand. Also know your problems. And then also during this kind of question and answer section, don't get offended and act offended if the person interviewing you doesn't know your file as ready as well as you. So think about when you're on a shift and you ask a patient to give you their medication list, and they say, oh, it's in my chart, just go look at my chart. Same thing with their past medical history, right? You're like, yeah, maybe it is, but A, your chart's not in our system. B, you registered under a different birthday today, so I have no idea what your actual chart is. C, like the chart is really hard to find and nobody ever updates the medication list anyway. And D, you haven't been here for 6 months, so it might have changed, right? That same like irritation that you have when a patient does that to you is what we would feel if you kind of gave us that attitude about your file, right? So assume that we are a little bit familiar with it because we've looked at it the day before, the day or the morning of, but we're not going to remember every detail. So if we ask you what seems like a pretty obvious question, take it in stride and give us an answer. Take it as an opportunity to show us your personality and let us get to know you a little bit more. A word on the residency coordinator. I told you before the program director was probably the most important person. False. The program coordinator is the most important person. This person deserves all of your respect, all of your kindness, all of your goodwill. This person has a huge impact on the decisions made by the program director. You might think you're dealing with some kind of lowly admin person or something. You are not. So every interaction with that program coordinator needs to be at the utmost of your professionalism. Be nice to this person, be courteous, be professional in every single email, in every single phone call, in every single moment you are with that person. And then just, it's obvious, right? But don't make any huge major faux pas, right? So just don't be distracted. Don't fall asleep. Don't show up drunk. Proofread your emails. All of those things. Don't be one of the people that the group of all New York City people text about after an interview. Okay, that's never a good thing. So be on your very, very best behavior. A few things about if you're able to travel. If we're doing in-person interviews, you might be traveling across the country. Only carry on luggage. Luggage gets lost. It's unfortunate, but be prepared for that. So make sure that you are able to pack in a small enough luggage that's coming with you on the body of the airplane. Be careful of being too casual. Do not swear, of course. Do not call anybody by their first name unless they tell you to call them by their first name. This is a very professional situation. And then, inevitably, things are going to happen. You're going to spill on yourself. You're going to get deodorant on your shirt, whatever. So have backup plans for things that are going to go wrong. I carried a Tide pen I had a very hyper organized interview season. So I had a Tide pen in my purse at all times. If you're traveling from one interview directly to the next interview, make sure you have, multiple blouses or multiple tops, so that if you spill on one, you don't have time to get it dry cleaned before you go to the next interview. You have a second one to wear. Sometimes people will come into the interviews and hand us CVs or hand us their journal articles that they have published, things like that. We can talk about this more in the question and answer session if people have a different opinion from me, but I don't think you need to do that. I think it's a little bit weird. It feels a little bit weird. I have everything. It's just killing a tree to print that out, and then you might get judged on the weird paper you chose or something. So I don't really think that's necessary, but we can talk about that in the major group. Meet as many residents as you possibly can. So that's going to the socials. That is spending time at any other recruiting events that they have. If the program falls into your top half a dozen of programs and they're having some special social night on Zoom, show up for it. Get to know a sense of their personalities. These are the people that you're going to be spending your next few years with. As much as the program director's mission and vision matters, if you don't like kind of the sense of these people, you're going to be unhappy. So get to know them. Similar to what Riddy said, the thank you cards and follow-up emails and stuff give people a lot of stress. Don't stress about it. Send one if it makes you feel good to send one. Don't worry about it if you don't. I think they used to be more expected. We don't get a whole ton of them anymore, and it literally makes no difference to us. So we can take it or leave it. If your grandma raised you to write thank yous, then go ahead and write a thank you. And then second looks, provided we're at a COVID state of the world that you're allowed to do them, it's for you if you want it. You can go back to kind of see what the department is like when people are not on their best behavior and see when it's not being a show put on for you. It's not mandatory. I don't think most programs are going to hold it against you if you don't do one. I don't think it makes or breaks where you show up on a rank list, whether you chose to do a second look or not. It's really something that's there for you. So kind of summarizing the major key points, don't be scripted, don't be over rehearsed, but this is a very important day in your life. So be a little bit practiced at least, so you sound like you are polished, professional, and know yourself. Be prepared. So come in with questions about the program, do your research on the program, understand the specifics about the program so you sound ready when you come into the room. Similarly, be aware of your own problems and be ready to talk about them. They will come up, they will be addressed. That is not a deal breaker. We just want to be able to understand them. And then last is kind of just be polite, right? Be on your best behavior, look nice, be nice to everybody. Don't be on your phone when people are talking, and you'll have a great day.
All right, another virtual round of applause. Thank you, Dr. Beck Esme, with tons and tons of pearls of wisdom there on how to do well on the interview day. No need to recap because she did it for us, and I got a few questions that stemmed from that presentation. So we'll have some discussion points coming later. All right, our final, and definitely last but not least, is Dr. Adamakos, Dr. Frost Adamakos. She is going to talk about how to find your fit and rank like a pro. So you're done with all the interviews. You're probably making this humongous Excel spreadsheet. Now it's time to actually rank. Dr. Adamakos is the Vice Chair of Education at Metropolitan Harlem for the Emergency Medicine Residency, which is part of New York Medical College. Dr. Adamakos, thanks for being patient with us, and thanks for joining us. Floor is yours.
Thanks, Eric. I'm just going to share my screen. Okay, so we have heard a lot from a lot of great people today. My goal is to hopefully summarize all of that into the last final step that you guys have, how to find your fit and rank like a pro. The information I get from here is similar to Eric and I believe a few other speakers. A lot of it does come from EMRA. EMRA is a great resource. We all use EMRA. We all love EMRA. A lot of it comes from our group, AllNYC, and some of it comes from just my personal opinion and professional experience. So you're going to get a little mix of everything, but very heavy on the EMRA side. Okay, so I'm just really going to go through a list for you guys and try to summarize the key points that you need to know on how to make that rank list and end up at a program that you're happy with. So we've already talked about this. Number one is location. So this is really going to be the limiting factor for you guys. You might interview at a bunch of places, but where do you want to end up? Because at the end of the day, this is all about being happy. So pick a geographical area that will make you happy, or you and your significant other. And that's going to be where you're going to start ranking your first programs. Now, in terms of location, there's a couple things to know. So about 41% of programs are academic, 44% are community, the rest are urban. And there's a couple things to keep in mind what that means. So academic programs tend to be really heavy on consultants. They've got a lot of subspecialists, a lot of great people to learn from. As a result, what tends to happen to academic programs is that you might fight for procedures a little bit more, or it's going to be maybe a little bit less procedure heavy and a little bit more learning by watching specialists. Community programs tend to be heavy on the geriatric side, a lot less consultants, so you're doing a lot more procedures on your own. And urban programs, which is a lot of New York City, is going to have generally more trauma. You're going to be taking care of more the underserved immigrant population, low socioeconomic status. So these three things will kind of play into location a lot of times. And those are things to consider. Do you have a preference? Do you know that you have a preference? And you might not know that, and that's okay, but you should know what comes with each different type of site that you might rotate at, or what type of residency you'll be at. Now, education. So this is from the EMRA website, the things that people say is important to them in terms of making a residency. So what's their education like? What's their conference like? Who teaches at their conference? Is it very resident heavy, where the residents are giving all the lectures? Is it only the same 3 lecturers who are lecturing over and over again? Or maybe it's not even a lecture heavy conference day, but they're doing more small groups, flipped classroom, you're going away to conferences. Try to get a sense of how they're teaching. Is it a senior resident who you're going to be presenting to as an intern, or is it going to be an attending? Because you may already know if you have a preference on what your learning style is. So it's important to kind of gather that information. Research. So we get asked a lot on the interview trail about research. So every hospital does research. It's an ACGME requirement that you participate in a research project during your residency. So you're going to get research anywhere that you go. But depending on the type of place that you're at, it will determine the quality of your research. So if you're at a really big name, fancy institution, you're probably going to have the opportunity to be part of bigger clinical trials, multi-system research projects, really high-end research. Is that important to you? I mean, if it's not important, that really shouldn't play a major role in how you're making your rank list. So I know it's a question that gets asked a lot, but you need to do, this has come up a lot in our day today, some soul searching. And is it important to you? Why do you want to do research? Do you want to go on and get a PhD, MBA, MPH, and you really have a passion for X type of research? Then yes, this is something that will help you determine where you're going to put programs on your rank list. But otherwise, I think for a lot of EM docs, this isn't a make it or break it for your rank list. The people. So as mentioned in talks before, what's the environment that you're going to be around? So who showed up to the socials? Who are you interviewing with? Is everyone a bunch of weirdos and you just don't get a good vibe from them? Did you get along with the residents? Were people nice to you? Do the residents hang out? Do they hang out with the attendings? Is that important to you? What's the relationship between the attendings and the residents? These are all not really, and they might be questions that you'll ask residents, and that's totally fine, but it might be things that you just gather by watching what's going on during the socials or the interview days. And for some people, this is really important, that I want a place where it's more informal with my attendings and we all hang out and we're one big happy family. And I'm going to tell you, every residency is going to say that they're a family, but that's really for you to figure out. Or is there a little bit more of a hierarchy and a structure, and you tend to be a traditional person and you like that environment? Or this doesn't really matter to you so much. I'm going to go ahead and say that, and Emra says that this is actually a pretty important factor. So get a feel for the different types of people that you're going to be around for the next 3 to 4 years. Because 3 to 4 years is a long time to be miserable, but if you're happy, it's going to go by really fast. So the size of the program and the diversity of the program. Some students seem to care about how big the program is. I personally am not 100% sure why. I mean, you can have programs that are super small, maybe 6, 8 residents a class. You can have programs that are really big, 20 plus residents a class. And for some people, that makes a difference. Are you really someone who likes personalized attention and a small group? Or are you someone who wants to have more people around and different opportunities to make different types of friends? Most programs, even in big programs, they might be able to still give you that personalization that you need. And the way that you're going to help figure that out is, on the interview day, does the program director seem to know a lot about the residents? So the size of the program may or may not be a factor for you, but keep that in mind. And the diversity. So are you interviewing somewhere where all of the leadership is male? I'm going to throw it out there. Maybe all of the leadership is white. Maybe all of the residents and all of the attendings are white, and you just can't get along with that. Now, keep in mind, there's a lot of changes going on, and a lot of programs are trying to put diversity as something really high up on their agenda as important. So this is really for you to figure out how important this is to you. You can also ask programs, I noticed that you are male heavy on your leadership, female heavy on your leadership, very white heavy. You don't have any African-American residents, or whatever it is that you're looking at, and see what the program's response is, right? Because you may get an answer. We just happened over the years to keep hiring. We hire internally a lot, and our best candidates have been people who've been with us for a while, and they have tended to be male. But to be honest, we're actively looking out for more female leadership. We have a lot of female faculty that are really successful and have businesses that, you know what I mean? There might be other things going on. They might say that we've really tried to recruit more of a diverse resident population, and they may have a good answer, or they may have not a good answer, and they may give you a weird look and say that it's not terribly important to them, or they think that their program is diverse when it's not. So if this is for you to figure out how important it is for you, and to ask the questions that you need, because it might be weird to end up somewhere that you really don't feel like you fit in. Now, what are the values of the program? This might sound a little bit esoteric, but this is important for some people. So how does the program handle, or how does the hospital handle patients of low socioeconomic status? There's going to be some hospitals, some institutions where you don't really see poor people a lot. You tend to see a very high-end patient population, and you may not be okay with that, or they may treat their alcoholics a certain way or X type of patients a certain way. So that's something that if you're really unsure what the vibe is that you're getting, how they're taking care of their patients and how the residents and everyone talk about certain types of patients, that might be something you want to investigate. And it actually might be something that a second look would be helpful for, because for a lot of people, this is actually really important. You want your values to align with the programs. What's important to them should also be what's important to you. Another thing that's come up as important for students to make their rank list, how students make their rank list, is wellness and work-life balance. Now, I put a question mark here because, I don't know, call me old school, but residency is tough. It's going to be tough. It's going to be 3 to 4 years. And then life goes on and you're going to have, you're going to figure out the rest of your life. You have the whole rest of your life ahead of you after residency. So, I mean, you have to expect it's going to be tough. And I think most programs these days, is actually part of an ACGME requirement, have to have some sort of response as to what they do for wellness. But for some people, it's going to be more important than others, how their residents are able to handle their work-life balance. So 8-hour shifts, 10-hour shifts, 12-hour shifts, how many shifts in a month? What do they do for wellness? Do they just do like a lecture here and there? And we all know just a lecture on wellness, and I give lectures on wellness, but that's not the end all be all for wellness, right? So get an idea of what they do. Keep in mind, residency is going to be tough. And if you're really, let's say you have a family, and for you, you recognize that work-life balance is really of the utmost importance. A 4-year program is going to add a year of residency, but it might also give you a lower workload during the 4 years. That's not always 100% true. So again, ask the questions that you need, the types of shifts, how many hours the shifts are, the length of the residency will make a difference. And what does the residency do for wellness? Is it just everyone drinking and you don't drink and, you won't get along with a bunch of people who are just getting drunk all the time, right? These are little questions that you're going to get on the interview socials and even on second looks. Another thing that came up that I had to put question marks about are the things that students have said are important to them when making their rank list. The opportunities that the hospital or the residency gives you. So for example, some people will make the rank list and say, well, this hospital is going to pay for my meals, is going to give me parking. I got a really fancy lounge. Those are things that, while they sound enticing, it's almost like when you go to do a locums and they give you like a huge sign-on bonus. It's enticing, but it doesn't really always make a difference at the end of the day. One hospital might pay you more, but they're not paying for your meal. So it actually ends up being the same thing. Paying for X amount of meals over a year might only be $2,000 extra dollars, and another residency is offering $5,000 extra dollars. So these little nitty gritty things probably shouldn't be how you're making your rank list. Other opportunities that might actually change the way you make your rank list is, do the residents go off and do fellowships? If you really want to go do a fellowship, most residencies will prepare you. I mean, I can't say there's going to be a residency that's going to not prepare you to help get your top choice fellowship. But if you want to do an admin fellowship, you're dead set. Going to a place that already has that admin fellowship that is an awesome fellowship is you would probably want to rank that program higher because of that, right? So there are some different opportunities that you might look out for that programs offer, but the little tiny things, honestly, probably shouldn't be the make it or break it, because you have to be happy at the end of the day, and those little kind of money things won't really make you happy. Now, the reputation of the program. So EMRA, I'm going to speak for AllNYC and myself, are all going to say, be a little careful with this one. So what this means is, if let's say you're hearing from everyone or from people or Reddit or whatever online resource people are using, that you guys put stuff online, this program is X, this program is X, this program is good, this program is bad, this program is whatever, you got to be a little bit careful with that. So there may be some truth. So if there is a red flag program, and year after year, you hear that the residents are miserable, the residents are saying that they're miserable, they are saying they don't like their program director, I mean, that has some merit in it, and you might want to put a program like that lower on your rank list. But just going off like the Reddit chatter and almost the gossip can really be misleading. I mean, Programs change all the time. Like we said in previous lectures, you might be interviewing with one program director and that changes. Usually there's somewhat of a heads up, but not always. Life changes. Things change, old programs change, and they do great things. New programs can fall, right? So the reputation thing, you've got to be very cautious with this. I would take what everyone says with a grain of salt, but if you're hearing from the mouths of the people that are there that they're absolutely loving it and everyone loves it or everyone hates it, then you can probably hold some merit in that. Now, the big question, 3 versus 4 years. So this may or may not play a factor in your rank list. So what I'm going to say is that you're going to get a good education no matter where you go. You're going to do enough procedures. You're going to get your research experience. You're going to get a great job, God willing, when you graduate. And a 3 to 4 year residency shouldn't really be the major factor as to how you make your rank list. It should really be more like how happy you are, all these other things that we're talking about, that's going to put together what's making you happy. Keep in mind though, and it's not really going to affect the type of job you have when you graduate, but there's a couple things to note. There's some caveats. So if you go to a 3, and this is specifically in New York, this really, really holds true. So if you go to a 3-year residency and you graduate, most likely, and not always, there are places in New York that do this, but most likely you're not going to be able to immediately after residency get a job at a place that has a 4-year residency, right? Because then you're supervising someone who has literally the same experience as you. Now, that's not always true. Sometimes places are busy enough that they can hire you and you just won't work with the 4th-year residents, or they don't even care. And New York is a really unique place where we have, the majority of the country has 3-year programs, and we have the majority of the 4-year programs. So if you know you're sticking in New York, you do have to keep this in mind. You graduate from a 3-year program, you're probably not going to be getting job offers at the 4-year sites. Besides New York, it really doesn't play as much of a factor. And now, as for like a 4-year program is more academic than a 3-year program. Yes, but 3-year programs have scholarly tracks. 4-year programs have scholarly tracks. Some people will actually say that if I go to a 3-year program, I'm more likely to do a fellowship because I have a little bit more time. If I go to a 4-year program and I did my scholarly track and whatever, now I'm really not likely going to go and do a 2-year talks fellowship, right? That's 6 years as opposed to 5. For a lot of us, we're getting to that point that we don't want to keep doing extra years. So while 4-year programs are more academic and you have more time to build a stronger academic portfolio, you can do it in 3 years. And there is an argument that you go to a 3-year program, you might do a fellowship. You go to a 4-year program, you're less likely to do a fellowship because you just want to graduate and make money. So, and again, this shouldn't be how you're really making your rank list. Like, it might play a factor towards the end, but I wouldn't say that that should be your number one deciding factor, 3 versus 4-year. And really, at the end of the day, and I've kind of been insinuating this, it's all about the feeling that you get from the program, right? And someone actually stole my thunder, put it in the chat already. It doesn't really matter, all of these little things. And there were great comments about after your interview day, write down the things you loved, write down the things you didn't love, write down your feeling, keep updating your rank list as you go. Those are all great tips because it really is just about a feeling. Did you love the place? Did you not like the place? You might be interviewing at, X super famous emergency medicine residency, and you just you don't get a good vibe. You don't get along really. You didn't really jive with the people. You left there and you were like, yeah, probably shouldn't spend 3 years of your life working 60 to 80-hour work weeks at a place that you felt like that. You might go to a smaller program, you fall in love with the PD, you fall in love with the leadership, you fall in love with the residents, and you're like, I don't know why, I just love this place. And that's totally okay, because at the end of the day, your gut is really never going to steer you in the wrong direction. Your mind is always going to play games on you. It's always going to convince you should do this or convince you shouldn't do this. It's kind of like dating. But your gut, what's that feeling that you can't explain, is never going to steer you wrong. So you're going to have to, and I know it's hard for us scientific people to do, but you're going to have to really go with your gut on this one. How did you feel? And that's really how you should be making your rank list. So that was for the rank list. I kind of brought that up already. The last thing to mention, to couples match or not to couples match. So this is a really complicated question to answer and can probably be like a whole textbook written. So couples matching is it's a very complex algorithm, and there's probably, I'm not even exaggerating, a million different ways that you can make your couples match. You can say who gets priority. So if they match and I don't match, we're going to let that person match. Or we can only both match in the same city, the same state. There's a million different ways to do this. So my best advice for this really is that's where your advisor at your medical school is really going to come in handy. Or if you don't have an advisor at your medical school, maybe reach out to someone that you met along the interview trail or along your rotations and ask for advice on how to do this, because it's a really complex algorithm. It could go a million different ways. You have a lot of options. And I really think an advisor is best because everyone's scenario is different. So in summary, I really only have one major thing to say. You've heard a lot from all of us throughout the day. Is really just find a place that makes you happy, guys. I know this sounds cheesy and I know it's hard because we're scientists and we're used to things being black and white. This is not black and white. Just find a place that will make you happy. 3 to 4 years is a long time to be unhappy. 3 to 4 years will also go by like a blink of an eye if you're really happy. So just whatever it means to you, location, the people, you just had some feeling, just go with that. And that's how you're going to make your rank list. And that's it, guys. Thank you for your attention.
All right, one more virtual round of applause. Thank you so much, Dr. Adamakos. Even more great advice on top of all the great advice we've received so far tonight. And remember, if this seems overwhelming, or if you weren't here for the whole thing, we are recording this. And somehow, some way, we'll get this on a website for people to be able to look at again. So thank you again. So it's 8:20 now. Let's take a 5-minute break. We'll come back at 8:25. In the meantime, please send me your questions on the chat room. For those who came in a little bit late, we are not going to do breakout rooms. We're going to put all the questions up here so everybody can hear them at once, and we can pick the brains of the amazing faculty that have joined us today. And then that way it'll be recorded for future reference. Thank you to those who sent their questions so far. I have a whole bunch of them already, but in the next 5 minutes, please send me your questions and then we'll take them down one by one. We'll get back at 8:25. All right, see you in a few minutes. All right, welcome back, everyone, and thank you for the outpouring of questions that just came in. I think this is more of a testament to the conversation that we wanted to generate, unless that we didn't answer anything in the first place, because the questions are really detailed and specific, and they're going to address a lot of things I was hoping we'd get to. So I want to welcome the rest of the All New York City EM crew that joined us today to volunteer their time to help be part of the Q&A session. I'm going to just go based on who I could see here. So I see Dr. Silverberg from Kings County, Dr. Jones from Jacobi. I see Dr. Hussein, who just got off his critical care shift at Staten Island University Hospital. And I'm sure there's others too that I'm just not seeing their faces pop up. Dr. Wynn, Mount Sinai, Beth Israel. So I think the best way to do this, let's go for a half an hour. We'll have a hard stop at 9 because I know this has been long for everyone. Some of the questions are related to each other and they kind of jump on different themes. So I'm just going to ask the questions that came up that I think are probably relevant to the most people. And then if your question's not answered, I'll be happy to give you my email address so you could ask some of the questions. Okay. The big question, which I think we should be prepared for, but maybe we're not, is the consensus statement that recently came out about number of rotations, right? There's terminology that can be confusing. Am I an orphan school if I don't have a home rotation? If I do more than one rotation in emergency medicine, are you going to cut me, from your list? So for the All New York City EM panel, how many rotations is too much? Do you have a set number of rotations that you are recommending? And is it a red flag if somebody does more than 2 EM rotations, so to speak? And then the piggyback question off of that is, if I do ultrasound or tox or something EM related, are you counting that as an EM rotation?
Well, Eric, I'll jump in first if you don't mind.
Sounds good.
I'm getting poked and prodded by some of my colleagues. So first off, my name is Mike Jones. I'm the Residency Director and Vice Chair for Education at Jacobi and Montefiore in the Bronx. I want to start and just say thank you to all the students. I think it's really a true testament to who you are, that in this very difficult time, you're looking to run into the fire and be part of emergency medicine and a field that really, truly, we all believe saved New York over the past year. And with the wonderful work we've done at every institution, we're really excited to welcome you. This has been perhaps the most difficult application season the past year and a half that we've ever experienced. And I certainly understand the qualms and the uncomfort, the discomfort that you guys all have, and the fact that there is really no clear good recommendation. I think the best that I can say to you is, if you have a home rotation, you should do a home rotation, period, right? If you are looking for a very special niche market, for example, you're a New York City medical student and you're dying to get to the Pacific Northwest and you have no ties there, you're gonna probably have to figure out a way to get an away rotation there. But if you're a New York City med student and you're looking to stick around in New York, I don't see a huge benefit in going and rotating someplace else. I don't see a huge disadvantage if you do. I think you need to speak with your advisor and look at your portfolio and just kind of decide, is this the right fit for you? And that's kind of vague. It's not great, but that is the answer. The COPA statement was designed to prevent this angst. And one of the questions I saw in the chat is whether we think that that's going to change. They were not supposed to change it the last time they changed. It was supposed to hold for the entire season. And so they've only created more confusion and angst for all of you. And I'm sorry about that. I know that seems like a sort of a non-answer. I think everyone needs to figure out what works best for them. One home institution, I think, is great if you have it. If you don't have a home institution, then by all means, call up any of us. We will certainly welcome you and get you plugged into our rotations. And I think that's sort of a good start and overview of the dilemma and the problem. So I don't know if anybody else wants to add.
I guess the question off
That
of
was
that
pretty
is
thorough. I
there
don't
a
think I have
number of
anything.
rotations that is going to be a red flag to you? If someone did 3 rotations in emergency medicine, will you still consider that applicant? And if so, is that going to be a discussion point during the interview? Why did you do 3?
I think if you can get 3, then that's fine. You can do them. It may, make people wonder why you did 3. I think more importantly is that you get a letter from every one of your rotations. If you do a rotation and don't get a letter, people are going to question why you didn't get letters. Because you thought you didn't do well there and you didn't want to publicize it, or what was the reason you didn't get a letter? So if you go, definitely get a letter from wherever you go. But I think it's going to be tough to get 3 in the first place. But I don't see any reason to do more than 2 unless you're trying to go, let's say, from the East Coast to the West Coast, and you just want to try out programs and you want to see what fits you.
Mark, I'm going to kind of disagree with you a little bit. I think if you go out there and you grab 3 and you don't have a good reason, as program director, somebody who's reviewing applications, I'm going to really scratch my head and say, why? Why did you take 3 rotations? Look, there may be very good reasons. You may have taken the year off and already have done 3 rotations last year, and that's a good reason.
You definitely need a reason. I agree with that.
The point of the COPA statement, and what I think we all support, is the fact that the world is a very difficult place now. Travel and all these different recommendations are constantly changing, and we're trying to make certain that we as programs and you as applicants act in an equitable and ethical way, I think is really the best way to say it.
I'll piggyback a tiny bit because I see what Mark and Mike are saying, and I would actually just remind everybody that before all this went down and there were statements and policies and schools limiting things, it was considered that for most people, 2 away rotations is the ideal number. You can get it done, you can schedule things around it. Program directors have no issue about your home people said X and they said Y, you have 2. So going for 3 needs, even beyond that, an extra special explanation, because you might be shooting yourself in the foot. Now, if you think your application needs that extra push, that is okay. I would recommend that you do your 2. And again, your school may have their own rules. Don't violate your school rules. But you could do a 3rd as EM toxicology. You could do sono. You could do anesthesia. There's a lot of things you could do to build your away without making this it depends and who's mad at it and what, right? So you do not want to poke that bear because honestly, the people in this room will hear your explanation and go, that sounds reasonable. Someone, just like they screen on step 1s, will screen you for that. And I don't want that to happen to you, right? Do 2. And then if it's a 3rd, do a thing that's not EM, is my advice.
Great advice. And just for the sake of time, we'll have about 2 or 3 of us each try to address each question, and then we'll move on. So that kind of dovetails into the next question, which came up, which is, I'm applying somewhere for X or Y reason that is nowhere near where I live. And I know that a lot of PDs and clerkship directors and APDs look to see if there's a connection, to the location and the geography. Where in the application, or is there some sort of communication? Is there somewhere where they could say, hey, I actually want to come to New Jersey or somewhere like that?
Nice try, Eric. I'll start. So now you have the option that you can write personalized, you can write personal statements, and you can have them go to different programs. So that's really going to be the key here. If you spent all your life in New York and for some reason you're now dead set on going to California, which we know is competitive, most places want to see a tie. And even in New York, we tend to want to see a tie also. When you're from I'm going to pick a small town. Please don't get mad at me if it's not a small town. I don't know. You're from a small town in Kansas and you come to New York. A lot of residents are fish out of water and they're unhappy and they struggle during their residency because the transition to living in New York is hard. So even us in New York, we're a very, diverse city and multicultural. We tend to also kind of like to see why you want to come to New York. So you got to tie that in somewhere. Your personal statement is a good, really good place to put that. If you've done extracurriculars everywhere, if your hometown was California, but you did med school in New York, you want to put that in the demographics. And then on the interview, I'm going to personally say, and I'm curious if anyone has a different opinion, you kind of got to give a reason why you want to go there, right? You're applying to Wisconsin. You somehow got an interview in Wisconsin despite having no ties to Wisconsin. I don't know. I'm going to say you kind of got to find a reason, or else it's going to be really odd, and they will probably put you lower because they worry that you will not be a happy resident there. So I'm not going to say lie and come up with something that's fake, but you got to find something.
All right, great advice. Next question is, we touched upon post-interview communication a little bit. And it seemed like, during the talks, it was like, well, we don't really make much of it. What's the consensus from the group? Do you, you don't have to answer this, I guess, but do you respond to everyone? First of all, do you remember the emails? How much weight, if any, does the post-interview, I'm ranking you number one, or I'm ranking you very highly, actually have on your rank list?
I'd say 0.00.
Yeah, for us, I don't think it really means a ton. I mean, if it's somebody that we really liked, it might reinforce where they are on the list, but I don't know that I would change it very much. It sort of depends. I mean, if somebody's pretty high on the list to begin with, it's, we'll get them then if they got us as number one.
I would say, just to add, and I guess Mark and I are not agreeing all that much tonight. That's usually actually odd. But I read every email that I might not respond, but I read everyone. And if you tell me you're ranking me number one, then I take that to heart. And I think that's it does, in some respects, whether conscious or subconscious, it does influence a bit my decision on where I put you on my rank list. It's not going to take you from number 300 out of 301 applicants to get you into my top 21. Absolutely not going to do that, but it may move you a little bit closer to into a range where you're guaranteed to match, or you're sort of a questionable maybe. So I do think it's worth sending polite thank yous, as well as, if you are going to rank a program one, tell them. It doesn't hurt in any respect. Although I will tell you, I think we all know, if you did say you were number one and you lied, we all figure it out. It's just not a cool look.
Don't be that guy.
And again, just kind of like what Riddy said before, if you don't get a response, that doesn't mean that we don't like you and that we're not ranking you highly, right? It's just that people are inundated with emails. And so it's really, a low risk, high reward kind of thing, but don't worry about if you don't get a response from there. Moving on to the personal statement. We got a couple of questions about that. And so I'd love to hear from the group. If you read the personal statement, at what point in the application process do you do it? Night before the interview, right before the interview? Is it part of your interview selection process? And one of our students here specifically asked, is it okay to inject some humor into the personal statement, or should I just play it safe? And Mark, I think you've given a talk on this before, so happy if you want to chime in. I think Frasso has something to say also.
Sure, quite a few times. I think that every program does it differently. Me, myself, I would just sort of skip the personal statements when we were selecting people. And then the night before we were interviewing, I'd refresh my memory on what they said. I think that the personal statements can hurt you a bit if you don't strike the same chord of humor as another person. Or if it's a really, really, really good personal statement, then it can help you. But I think for the most part, personal statements are neutral and don't change your application that much.
I'm going to disagree. And we're all going to have different opinions, right? We're like, however many, 20 programs in here, right? For me, and maybe it's just, year after year going through the interviews and it's applicant, it all looks the same. I really like the personal statements. Now, don't get me wrong. A lot of the statements are going to fall into like a neutral category, But when you have something special in there, and you should try to find something special. I know we're not all that, I'm not that special. I'm not a very interesting person, but you got to try to sound like you're somewhat interesting. Please, for the love of God, do not say that you love traveling. We all love traveling. That should not be what your personal statement is about, but find something that makes you stick out over the crowd. And the personal statement can help that, because I still remember one of my residents, this doesn't matter the story, but I remember the story in her personal statement, and that stuck with me, right? And so if you can do something that makes someone remember you because of it in a good way, that's good. And as well, Mark actually insinuated, although you said it doesn't really play a factor, if you've got grammar mistakes in your personal statement, to me, that's just it's a kind of a red flag. You didn't take the time to get it proofread. If it's kind of 2 pages long and it goes on and on and on, it can hurt you, the personal statement. So I would say you're going to get different answers on here. Assume it's important. Have it proofread by different people. People are going to have different opinions. Do what's right for you, but also keep in mind other people's opinions who are experienced in the field.
Also, I threw this one in the chat, but make sure you have the right personal statement. If you're applying to 2 different specialties, I mean, I had one this past year that was like, this is why surgery is for me. And this is why we're not interviewing you, right? I mean, if you know that somebody wants something else, are you going to give up a valuable slot for that? I'm going to echo what Frasso said about the grammar. It really does matter. It makes it seem like you didn't spend time. Even on applications, I saw people like someone this past year didn't capitalize their name. We've had other people that had all caps in their applications. Like those little things actually matter. It makes it look like you didn't spend time.
Great advice. Yeah. And I remember I had an email that was directed towards La Quinta Inn and Suites. It said, "Dear Dr. La Quinta Inn and Suites, please accept this." And so obviously if you're copying and pasting, just like, it's a cool name, but just, obviously proofread, because those are things that we remember for bad reasons. So I guess in the virtual reality that we have now, most interviews we think are probably going to be virtual, maybe an in-person option, maybe some of both. But if we're not having these dinners and we're not having the interview socials in person the night before, what's some advice for the applicants to actually get a feel for the culture of the residency if they're going based on what's on the website or what people are being told virtually? See, I like asking questions, I don't have to answer them.
It's a tough one, Eric. I think, a lot of us are very biased in terms of we spend way too much time on social media. And I would just remind everybody that social media is an opportunity to present yourself how you want to be seen. You can really tweak your image in different ways, and you would not know any better. So just be weary of that. I think the best way is to meet up with people, whether it's in virtual hangouts or at any of the national conferences or in forums like this. That's really, I think, how you're going to get a flavor for who we are. And that is so important to your decision of where you train.
A lot of people have websites so you can go look up what they're doing. You can look at the resident pages and see photo galleries of the things the residents do together. There are a lot of people that have journal clubs online, and you can try and get invites to those. We do wilderness medicine online. We do a bunch of other journal clubs online, critical care. So you can try and get into those forums. I'm sure during interview time, they're pretty open because the program directors want to advertise themselves and they want to draw students in. So that's another way you can find out some stuff about the programs.
A lot of programs will actually invite you also to their conference during virtual interview season. I know a lot of us did that. So that's a great way. There's a lot of small groups. You'll see the chitter chatter, how residents interact. So ask around. Eric, I'm actually gonna pick up on the geography question and ask a question that was directed to me. So this question is for geography reasons. I was wondering if you had advice on whether to incorporate mentioning a significant other if they aren't a medical student. So mentioning that you have a significant other or not, and I'm curious to see what other people think about this. It could help you. So if you are applying to I don't know, some small town somewhere in Ohio, you have nothing in Ohio, and you actually really want to end up there because your significant other just got a job there and you guys are gonna, I don't know, start a family, right? Like that would be appropriate in your interview to bring up. Although it doesn't look like I have any ties, it's actually really important to me and my significant other because they're getting a job transfer here. So we plan on staying. So it is really important to us. And then they would consider you much higher. If the significant other doesn't play a big factor into where you're ending up specifically, or you don't think, so I think it can hurt you sometimes unintentionally mentioning a significant other. But that also might be a good reason why you want to bring it up, right? So if you're part of the LGBTQ community and you mention that you're with the same-sex partner and they have a weird facial reaction or they subconsciously rank you lower because of that, that's probably better that you brought that up because you'd probably be miserable somewhere like that.
Yeah, you don't want to be there anyway.
So it would probably be good for you to bring it up. Or if you're married with kids and you're really looking for a place that's kid friendly, even if it's not the residents who have kids, the attendings have kids and they're supportive, you want to bring it up. But if you don't think it's going to help, I don't know. I personally think why bring it up? There might be some subconscious biases going on. So I would say if it's really important for a specific reason, bring it up. Otherwise, don't hide it, but you don't have to mention it because it could hurt you for some weird reason.
And remember that, you know, we're not supposed to be asking about those things, significant others, familial questions, etc. So if it's important to you, and if it's in your personal statement, that's one thing. But otherwise, if it's important, I'm sure all of us have interviewed people or actually increased someone's rank position strictly because of the tie to a community, because of their significant other. And I've absolutely interviewed people that had absolutely zero connection to New York, except that their significant other lives and works there. And you would never know that otherwise. So I do think it can be extremely important, but it depends on why you're mentioning it.
It is a double-edged sword too, because if your significant other is applying to the same programs you are, some programs may choose not to have both of you in the same program just to avoid issues about both of you matching there. So it can hurt you, it can help you, it depends.
And I'm gonna have to put a plug out for this. Will happen more often to women. It can happen to men as well, but I don't know. There could be some old school people out there, and you mentioned that you're married and they're thinking maybe you're gonna have kids, and subconsciously, this isn't crazy. Like this is a subconscious thing that still happens to these days. A lot of us women on here give lectures about this. Again, maybe you probably don't want to end up somewhere like that because they're all, I don't know, misogynists. Hopefully that doesn't happen much anymore. But that's why I'm a little hesitant. Like if it doesn't really make a difference, I don't know. What do you guys think? I wouldn't bring it up if it's not super important.
I think if you look at, your basic job application sort of guidelines, it should never be asked. But if you think that it's important to your identity and to why you're looking to be at this program, then bring it up. I think that's, just kind of, it's really is truly your decision. I am happy to have residents from all sorts of walks of life and who have all sorts of different setups in their lives and their families and everything. If there are ways that I can make people, happy residents are good things. So if they want to be in New York because their significant other is here, that's a good thing. So, and we'll help you in your application process potentially.
Great. Yes. And I think we have time we'll do two more questions. And I think Frost, you just texted me, you got one, two more. So how about I give one and then Frost, we can end with another one. So this comes from a second year student. And the student was saying, hey, I'm not exactly sure what specialty I want to go into. So is there something I can do in my free time that'll kind of translate well to anything? So any extracurriculars or volunteer activity that you think would translate well, not only to emergency medicine, but to anything?
Eric, did I get that right? That the question is, what extracurricular should I fill in on my application since I don't know yet what I'm going to do? Like
I think
I could
what you should actually do.
Yeah, like what should I actually do? Right. So I'm not sure if I want to do emergency medicine, but is there something I guess that translates to multiple specialties where they would all look at it and say, oh, this is a good use of time?
I mean, I would say that's a reasonable thing, making your rotation schedule. Like, I don't know, I might do critical care, I might do EM, I might do surgery. Maybe I'll do anesthesia, right, or something to that regard, right? But as an extracurricular activity, as a summer a happy place thing, I think I'm going to stray from some of the people, but I think you do your happy place thing. I think that you want to stand out in a good way. And sometimes that means you make your passions known. And if it's something that might be off the beaten path, it's not bad that you are the polka champion of the Midwestern corridor, right? And almost like Frosso was saying. I mean, the subject matter she was talking about was much more serious, but it's a little bit of a if someone raises their eyebrows at a thing you like to do, do you want to hang with those guys? Like it could be basketball, right? You love basketball and you want to see if there's people at your program you're going to play with, and nobody in the program plays basketball, and now you're hoping for an intern class of like some tall people, but you don't know. People find their fit in lots of different ways. I don't know if yours is going to be polka. I just think that picking a rotation with that mindset is probably a better idea than picking a hobby.
But I think you can also do stuff like medical Spanish that translates across everything, or ICU if you wanted all your specialties involve critical care. Do something that relates to any of their choices, and you should be good.
And Liz, I'm going to put you on the spot since you gave the talk about what we actually care about on the application. Is there anything else that you've seen on applications that seems just to translate well in general?
Translate well?
Volunteer work?
Like any sort of volunteer work or anything like
volunteer work. If you're thinking about EM, get into an EMIG relatively early, because then that can get you some ideas of what you're getting into. But I mean, we see people all the time that they thought they wanted to do something else. They were all in for something else, and then all of a sudden they realized, oh wow, I like EM, like in August of their last year. So
right, and EMIG being emergency medicine interest group, just to make sure everyone knows. And it's not a red flag. Like, I've been asked this too, like, oh, this person was in the surgery interest group too. Well, that's how you show that you're interested. We know that you're dedicated to our field, so don't worry about putting that on or putting on your application. If you're going in one direction, you decided that emergency medicine was for you after that. And I think that's what Pig said in the chat as well. All right. Frosso, we'll give you the last
I have
question.
one from the chat. So someone is asking to elaborate more on second look. So what is a second look? What do you do? What do you not do? Can it hurt by asking for one? So get into maybe the second looks a little bit more. Or anyone can talk about it. So what is a second look, guys?
I think, Mike, did you post that there was a policy on it about second looks and how it shouldn't affect how we?
Well, I think the question is someone doesn't know. So second looks are after you do the interview, you say, hey, and this was pre-COVID, none of us really know what's going to happen this year. Some places might be doing virtual interviews, but allow for in-person second look. So after you do the interview, you're going to ask a program, hey, can I do a second look? Which means, can I come back and I'm going to hang out in the ED and just watch a little bit. You're not seeing patients, you're not presenting patients, but you're going to come by the ED, spend, I don't know, maybe 4 hours and then leave. Now, generally, second looks are for you to figure out where you want to put people on your rank list. And this has been kind of brought up. So it's more for you to figure out, are they going to be number 2, number 3, number 1, number 4? If you go and you're a weirdo on the second look, although some people were saying it can't hurt you, I think that will hurt you. The resident will go to the program director and be like, this person was the weirdest person I've ever met. You can't hire them. And maybe we already knew that, maybe we didn't. But in general, it's good for you to do it if you need clarification where you're going to put someone, or you want to show extra interest. I don't think it can hurt unless you're a weirdo.
I think that everybody should do second looks for their first 1, 2, or 3 programs if it'll help them figure out what they're like. Seeing them on interview day is very different from seeing them work clinically, and knowing the nursing ratios and other stuff like that may help you make a decision. Like I said before, always announce yourself, have somebody bring you in, don't try and sneak in. getting caught by hospital security and being brought to the PD's office is a very not great way to meet the PD a second time. We've had that happen before.
Funny story. I actually had years ago, a student show up at one of our EDs, not announced, saying he was there for a second look, hadn't scheduled it, got to hang out for a little bit, and then was asking for me. I wasn't there working that day, but the next day I found him inside our private office suites, outside my office, waiting for me. He was promptly escorted out of the hospital. So don't do that. But it's a great opportunity for you to get to know the program. I did post the NRMP Code of Conduct. Take a look at it. As a program director, I'm not supposed to, require you to do a second look or to even utilize you doing a second look as a sort of criterion for ranking. That's in that Code of Conduct. So I personally stay out of the second look, knowing about it, organizing it, etc. I stay out of it completely.
Yeah, that's a great point. And also on the flip side, not every program, their administrative or their GME allows for second looks. So on the flip side, don't judge a program based on their ability to allow you to do a second look. It has nothing to do with you or the strength of the program. They just may not allow it, especially now in the time of COVID, for safety reasons and for other reasons. So don't weigh that too much in the ability to rank a place highly. We've got 3 minutes left. I think we have time for one last one. We'll squeeze it in. Timing. Does the timing of when we interview, and I know Riddy brought this up a little bit, but does it matter? You're trying to make your schedule. Should you put the one you want to go to the most, like in the middle, like around December or January? We have primacy bias and recency bias. You're going to remember the people who interviewed late. So to the PDs out there, do you care when somebody actually interviews? Do you even take that into consideration? I can answer that first, and the answer is no for me. I don't care if you interview in October or if you interview in January. We put the same exact weight, and we use the same exact process, whether you're interview number 1 or interview number 9 at the end of the year. And we're getting some more, same doesn't matter. Okay, well, this was a great 3 hours. I think there were tons and tons and tons of pearls, and from different perspectives and people, different levels of experience. Thank you all for your participation. I think up till about 20 minutes ago, we had about 70 students on with us, and a lot of people said that they're looking forward to the recording. So a huge shout out and a huge thank you to everyone at All New York City EM for joining us. Please go on the website. I'm hoping we will get this recording up there at some point, and make sure to follow us and ask all the questions you want as they come along. But remember, the odds are that you are competitive. There's tons of spots out there. And if you take just a little bit of our advice from tonight, you're going to be successful. So thank you, everyone who participated tonight. We really appreciate it.
Thank you for a great job, Eric.
Thank you.
Thanks, Eric.
A lot of fun.
Nice job.
All right. Have a nice night, everyone.
Good night.
I think I was recording this the whole time. Yeah, I was.
Yeah, it's recording. Eric, great job. Thanks so much.
Classic. It was definitely recording.
All right, Riddy, awesome talk. And then I guess, Mike, I'll download this. It'll be an MP4 file and I'll just send it to somebody, right?
Perfect. Sounds great.
All right. Thanks for joining. See you soon.
Thanks. Take care. Be well.